All right, good morning, everybody. My name is Dr. James Economopoulos. You all can call me Dr. I, and I'm the Tex-CHIP Program Coordinator. And just for those who are not familiar with Tex-CHIP, Tex-CHIP stands for the Texas Counselor Health Integration Project, and we are a grant-funded program by the Health Resource Service Administration. It's a behavioral health workforce and education training grant to strengthen the behavioral health workforce, to train counselors and other helping professionals on topics, special topics like this one, which we're going to be covering today, is grief and loss, and also on topics related to integrated behavioral health care. So today we're going to be talking about grief and loss, and we have some outstanding guests with us today. But before we introduce them, I'll have our Tex-CHIP graduate assistants introduce themselves.
Okay, good morning, everyone. My name is Shalana Landers. I'm a second-year doctoral student here at the university, and I am the Tex-CHIP graduate assistant.
Everyone. My name is Kelsey. I am also a second-year doctoral student and a graduate assistant for Tex-CHIP. Good morning.
Alrighty, and so now we have some outstanding panelists with us. Would y'all like to go ahead and introduce yourselves?
Yes.
Thank you. Whoever wants to go first.
I can go first. Good morning, everybody. My name is Cindy Waddle. I am a licensed professional counselor, registered play therapist. I have been working in grief and loss for about the last 9 years, and I'm happy to be here with you all.
I'll go next. My name is Erica D. Fulton. I am a doctoral candidate at Kairos University. My specialization is trauma, grief, and loss. I am a licensed professional counselor as well as a licensed chemical dependency counselor. I've been at LPC since 2021 and at LCDC since 2019. I'm also trained as a chaplain. I did a chaplain residency at Memorial Hermann for a year. So I had an opportunity to interact with bereaved families and their patients. And I had an opportunity to do different things such as naming ceremonies, baptisms. I've been with families when they had to take loved ones off of life support. And in addition to that, I also worked with youth ages 12 to 17 for a year who had co-occurring disorders. I am the owner and founder of the Calm Corner. And what we do is we provide virtual counseling services to individuals ages 12 and up who are struggling with sobriety, who are struggling to reorient to life after a trauma, those struggling to manage ADHD symptoms, or those who simply just need a safe space and a listening ear. My hobbies include line dancing and karaoke because I believe in self-care. I'm a heavy proponent. And I'm just racking my brain to think of anything else. I am a member of the Houston LPC Association, and I'm very passionate about grief and loss, especially with marginalized communities who lack access to therapy and resources. And so I'm very grateful and humbled and honored to be on this panel. And I just want to say thank you.
Thank you so much. Do we have any other panelists here today?
Yes, I'll go ahead and go. Good morning. My name is Siarra Stokes. I am also in LPC. I have been fully licensed since 2021. I've been doing for probably the last 7 years suicidal ideation, trauma, grief, loss, and some slight specialty in personality disorders. I'm currently the supervisor of the therapy staff at the Temple VA. For the last 2 years, I believe. So really excited to be here and have this opportunity to talk with you guys.
Thank y'all so much. Anybody else? Okay. Well, it's an honor to have you all here. Thank you so much for helping us today, and we're excited to begin this panel discussion. We have a case study prepared, and then we also have some questions that we're going to be asking. And then at the end of the panel discussion, students will have the opportunity to ask any questions that they want to have as well. We're going to be going till I think about 10 o'clock, maybe a little bit after 10, and then we'll have a break, and then we'll begin our training around 10:15, 10:20. All right, so I can go ahead and begin the reading of the case study, and then Kelsey and Lena will facilitate the questions. Okay, Adrian so this is the case of Adrian. Adrian is a 68-year-old woman. She lives with her husband, Andrew, age 79, in a modest bungalow in a rural area about 10 minutes from town. Andrew was diagnosed with lung cancer with metastases to liver and bone 10 months ago. Andrew had been feeling unwell for several months before seeking medical attention. He now is very weak and spends most of his time in bed. He has pain that is poorly controlled and eats very little. At times, he is quite confused. There is suspicion that he has brain metastases, but his wife and family feel there is no need to further investigate. His physicians agree. Adrienne was born in Montreal, and she has several brothers and sisters still in Quebec. Adrienne and Andrew have been married for 46 years. This is Adrienne's second marriage. She was married for 2 years to Pierre, a soldier in the army who was killed in Korea. Adrienne was left with one child, a daughter, Isabel, now aged 50. 3 years after Pierre's death, she met Andrew at work, and they married 2 years later. Adrienne and Andrew had 3 children, a son, Alistair, now age 43, a son, Jean, age 36, and a daughter, Anne, who died in a motor vehicle accident 10 years ago at age 24. Isabel lives in town nearby, but Jean lives in Seattle. The McPhersons have 8 grandchildren. Andrew has been a heavy smoker for many years. He's had hypertension and ischemic heart disease for about 10 years. He was a heavy drinker for a number of years, but he stopped when Adrienne and he separated for a brief period of time. He does not drink alcohol now. He worked as an accountant with his own small office serving small businesses and doing income tax work. He is Scottish and has 2 brothers in Scotland. He and Adrienne used to visit them frequently. He is worried about how Adrienne will cope after he dies. They live on their pensions now. Adrienne has had rheumatoid arthritis for many years, but was able to continue working as a department store clerk until about 10 years ago when he had a flare-up of her disease. She is on multiple medications, but has been able to do normal activities of daily living reasonably well with Andrew's help, especially with household tasks. She is concerned about how she will be able to cope with without Andrew's help. She does not want to bother her children for help. She's had to cope with the death of her first husband and her beloved daughter, Anne, and feels that she cannot cope with another death in the family. Their marriage has been quite strong despite the one brief separation. For 2 years after the death of their daughter, Anne, they grieved quite openly and they recovered slowly. Their children have been very close despite 2 of them living far away. They're both Roman Catholic and have attended church fairly regularly. So that's scenario 1. Are we going to move on to scenario 2 as well? I think this is what happens in the situation, I think, after his loss. So I think we can go ahead and read it. So with scenario 2, we have a phone call from daughter to physician. Adrienne seems very frail. She has lost weight. She responds to questions very slowly. She admits to crying frequently. She says she is very depressed. Her joints are bothering her more than usual. She is eating poorly because her appetite has decreased. Doctor says, Doctor, sorry, sorry to bother you, but this is Isabel, Andrew McPherson's stepdaughter. First of all, I would like to thank you for the care you gave my dad. He died very peacefully at home, thanks to you. It meant a lot to all of us, and we still miss him a lot. Oh, well, life is like that, isn't it? Why I called you is, well, as to talk about my mom, Adrienne. It has been about 6 months since Dad died. She really is not getting any better. I am really worried about her. I try to see her every day now if I can. She is just sitting there in a corner chair most of the time. She eats very little, and the house is a mess. She just doesn't seem to care anymore, and that is not like her at all. When I talk about my kids, she occasionally brightens up, but then she begins to cry. I have asked her to go and see you, but she hasn't made an appointment. I finally called and made her an appointment to see you next week. I just wanted to fill you in. My brothers and I are very concerned. Thanks for filling me in, Isabel. Are you coming with her? I think that would be helpful. All right, so now Lena and Kelsey, y'all can facilitate the panel discussion.
Okay. So the first question for our panel is, what treatment would you implement with Adrian?
I'll go ahead and go. I think it would honestly depend on if I was seeing her prior to the cognitive decline or beforehand, right? How I typically deal with grief is usually radical acceptance and then underlying emotions, right? Getting them to accept things that are out of their control and focusing on things that they can control and transferring that grief into something a bit more productive. However, it seems that following the death of her husband, she's got some cognitive decline, right? She's unable to do ADLs. So that would significantly change how I would approach this, right? Depending on what level of awareness that she has. And it would be imperative that her children are involved if this is something that she is going to engage in.
One approach I would definitely use is one of my goals would be to figure out which task is she struggling with. I highly appreciate and love Warden's model, how he breaks it down in tasks as opposed to stages or phases, which is nothing wrong with that. I would definitely do a loss history just to get a highlight of any previous losses that might be compounding the existing symptoms of grief that she's experiencing. I'm huge on psychoeducation. I would also just give her some education on the grief process, what it does look like. So normalizing would definitely be a part of the treatment. I would implement certain measures to be able to just track on a weekly basis her symptoms, if there's an increase or a decrease. Excuse me. And I don't want to say if, because clearly as I was reading, I saw some trauma in there. So in that event, I would definitely also utilize what I call a split treatment approach, where I am helping her process the trauma so that the grief can be addressed, because clearly there have been some prior losses. So that definitely would be part of my treatment. The interventions, for example, would be, okay, let's do some designated crying times. And as one of the panelists just mentioned, taking that energy and implementing it, or finding perhaps an organization of women who have experienced the same thing and using that energy, turning it into, say, maybe volunteering. So those are just some of the part of the treatment. And also, I would address any possible stuck points that might be connected to the grief. I would also address emotions, asking about regrets. And I would also ask about just how grief was handled within the family system. And so that will be part of my treatment approach.
Are you all able to hear me okay?
Mm-hmm.
It's wonderful. So I think I would echo some of what the other panelists had said. I think for me, I'm thinking initial first steps is really just taking a scaffolding effect approach in terms of starting with the basics. Reading scenario 2 gives me evidence that she is really struggling with the internal resources to be able to self-regulate with these long periods of crying, difficulty eating. I mean, it's affecting her daily functioning. So I would probably start with just a basic foundation of meeting her immediate physical needs, getting her on a healthy regimen in terms of diet and sleep, discussing and building her ability to utilize internal coping skills, and really setting her up with the resources so that she could be prepared to process the grief and any potential trauma there. I don't think that I would immediately approach the grief just because I see her struggling already. And if we were to really kind of stir up all of the complex and compounded grief, that she may not have the capacity to do that just yet. So there's definitely grief there. There's been multiple losses, but I think my initial approach would be giving her the initial resources that she needs to be able to process grief more long-term in therapy.
Thank you all. The next question is, how would you include other professionals to provide treatment in an integrative approach? And it's kind of a two-parter question. What resources might be helpful for Adrian?
Well, I'll start this one. One of the ways in which I would include other professionals, of course, making sure there's a ROI on file, release of information. I can think of two professionals, just the primary physician, the psychiatrist. Those would definitely be other professionals. As I'm thinking about resources, I believe, support groups, for example, Bo's Place, because they have support groups where it also goes by age. They have them for children, they have them for adults, just to create that sense of community. Because one of the things it did talk about was her isolating, which is not uncommon. So I definitely do recommend support groups as a way of her to build community, be able to share that grief and be around others who have experienced the same thing. I would also provide her with any resources that are going to address those lower level needs, those basic foundational needs, food banks, any resources within her church. I would encourage her to seek those out, or coordinate with the church to say, hey, what resources do you have available for my client? And so those would be some resources that I believe would be very, very helpful for Adrian.
I will second that. I appreciate the client's daughter reaching out to the PCP, collaborating with the physician. I think is a good first step in terms of just screening for any potential benefits to psychotropic medication, and if so, potentially a referral to a psychiatric professional. That is definitely a collaborative conversation we would want to have with the client. And then I think just referring back to the medical professional in terms of just mitigation management, addressing any underlying conditions. If she's been eating poorly for some time, she's not sleeping well, is there anything else that could be done, whether that would be seeking a nutritionist or someone that can help her build a plan, whether, I know there's a lot of even now, meal prepping and things like that, that would make it easier for her to have a healthy, balanced diet, connecting her with support groups. Also, I think there was a mention about her being involved in her church or regularly attending Catholic church, if there's a community there that can be of support outside of just the grief piece, but just building a support system, I think would be really important for her as well.
Something that I would do here at the VA, we have what's called caregiver support, which is where they will get individuals set up with caregivers, right? Whether that be family members or local nurses working with the service in getting her assisted. She had mentioned in scenario one that in preparation of her husband dying, she didn't want to burden her kids, though they are close and one of them lives close to her. So I would anticipate some resistance, even though it seems like her daughter is taking some initiative in wanting to help her mom. I imagine there will be a little bit of resistance in caring for her. So it may be more beneficial for Adrienne to have a caregiver that is not related to her, right? Especially thinking about her previous grief of losing her daughter. It just might be a little bit too much. Something else that I would focus on outside of providing physicians the ancillary information that they need to support their diagnosis and their treatment would be to get with social work, right? For me, when I'm thinking about grief, loss, and trauma, especially when it comes to veterans, my main focus is functionality. You need to be able to function on a daily basis. You need to be able to care for yourself. And having a level of self-efficacy, I think, is directly tied to growth and healing, right? If I don't feel like I can do this, I'm not going to do this. And so I think I would focus on making sure that her day-to-day, right, thinking about Maslow's hierarchy of needs kind of thing, I want to make sure that we address the things that are at the base so that we can focus on these more complex issues. It's going to be difficult for her to process the loss of someone she's been with almost 50 years if she can barely brush her teeth. She hasn't showered in 2 days. She's not talking to her family. She's not eating well. So I think that is where I would really seek out additional resources to help her bolster that self-efficacy, that daily functionality, and feeling confident to be able to address these things.
Yes, thank you so much. Thank you all. I'm going to pass it over to Kelsey for the next few questions.
Okay, hello everyone. So, what resources needed to be developed? Some of you kind of answered this question, but what resources needed to be developed within the community and or practice that will help their grieving patients? Who can they identify the lead to these efforts? That's where we're at, right? Yeah, okay, just making sure.
I think I know a couple of us mentioned just building that support system. There was reference to Bo's Place, which I know is in Houston. There are some communities, presuming this is, a community where there is a grief center or some type of established grief support. That is helpful, but many times we do encounter individuals where they live in communities where that resource is not available. So I think that is something that is a wonderful opportunity. I know some spiritual communities have programs like the Grief Share program, which are great resources. So I think that would be something that just comes to mind to me in terms of resources that may need to be developed. Community centers, especially for older populations populations where maybe they're looking to connect with other individuals their age and provide more of that recreational stimulation and support and activate those social interactions are some of the things that initially come to mind for me.
I would also look at national grief resources and utilizing telehealth. You know, following COVID, our world kind of really expanded when it came to accessing resources for those who may not have access to them. So I would look at national grief resources and trying to find something local or telehealth. I think the biggest thing would be support groups. I feel like support groups are really an underutilized, underrated source of support. Obviously, that's very big at the VA, where we feel like camaraderie and that connection is quintessential for growth and healing and getting I don't want to say getting over, that doesn't feel right, but moving forward with these big losses, sometimes having people to lean on is really important. So kind of echoing what Cindy said of trying to figure out what are some resources she does have access to and how do we implement those and how do we maybe even give them the tools that they need to help her.
One or a thought came to my mind also, because it mentioned about her attending church regularly. So I believe one resource that could be developed is, first off, inquiring if there are any particular groups within the congregation, group support groups, and even possibly asking, hey, can I come in and do just some general workshops just on grief in general and the I'll have a hard time with that word, symptomology. Okay, I got it out. And I believe also just seeing, okay, what is the spiritual leader's perspective on grief, just seeing if they are just familiar with the clinical side of it, so to speak. And I say that question as someone who's not just a therapist, but I'm also a pastor myself. But because I am a therapist, I get that clinical side of grief. But in some congregations, you may not necessarily have leaders who are informed in reference to mental health. Things are beginning to shift. But I would also make myself available as a resource to just develop that psychoeducational piece within the community and working in conjunction with the spiritual leaders, because again, it seems to me that one of her coping skills is community within her church.
Okay, thank you. I realized I did skip a question. I thought so. So going back, in your own profession, what professional example can you share regarding clients with symptoms of grief and loss?
For me and my clients, lots of survival guilt. And that guilt is normally displaced, right? A veteran that comes to mind, he really struggled with his triggers, right? He was a combat medic during OIF and OEF, and he did 4 combat tours back to back. One of the things he really struggled with, his anxiety was crippling, right? Constantly racing thoughts. He was hyper vigilant. He could barely go out, right? He couldn't go bowling because the sound of the ball hitting the pin sounded like a mortar going off, or the grocery store was fine, but he struggled at sporting events because the sound of screaming fans sounded like when he would have to descend off a chopper into screaming hordes, right? One of the things with him was that he felt like he could not let go of his grief, move his grief, transfer his grief, or do any sort of alchemizing, because the grief allowed him to remain close to those individuals that he lost, and it made it real, right? If I'm not here suffering, if I'm not here punishing myself, essentially, then they died for nothing. Who's going to go on to remember them? I had another veteran, he keeps all the names of the people he's lost in his phone, and he looks at it every single day, right? And he tells their stories in his head. And so a lot of times there's this, I think it was Miss Fulton who mentioned the stuck points. I think that is so big when it comes to grief, because it just puts a halt on things, especially when it's unexpected. And so those are kind of the things that I see. And so we talk about a lot, like, does your grief have to hurt, right? Does it have to be painful? Are there ways that you can honor the memory, keep these people close, maintain the love that you have for them, but also not torture yourself? I think when it comes to Adrian specifically in the case study, something that I'm always thinking about is the widowhood effect. There's a couple studies, of course, that have come out, I think since 2007, talking about the effect of couples who have been together for a long time dying sometimes within weeks or months of each other. And so that's something I'm kind of always thinking about, is like, how do we keep your husband's spirit alive, right? How do we keep him real, but in a different format? You know, for me, little spiritual woo woo, I feel like love is energy, and energy is neither created nor destroyed. And so figuring out, like, how do I now find the love that I have for my husband in a different place now that he's gone, you know, whether that be wearing his favorite color every chance that I get, or if she's someone who gets her nails done, getting his initial there, or wearing a locket, or wearing his dog tags. I'm sorry, I'm thinking veterans. I don't know if he was in the military, but some form of commemoration that they can return to, whether that be going to put flowers on the grave, having their own kind of memorial in their home. There's a veteran that I worked with. He for one of the wives of the soldiers that he lost had 2 kids, and she really struggled. So everybody in the unit that is still alive every year will go to her house, and she'll have a list of things that she needs taken care of, she needs done, and they go and they take her list and they complete her list for her. It takes them about a week. And for him, this was a way to kind of maintain that closeness. So I'm kind of rambling, but for me, when it comes to dealing with symptoms of grief and loss, I want to transfer that. I don't want to invalidate what they feel. I don't want to get rid of their grief. I want their grief to be more integrated in a healthy way. So
I'll go next. Wow, I had many stories. I remember I had this client who lost a son to fentanyl. It was basically this individual went over to Mexico and got some pills, but they were laced with fentanyl. He didn't know. And I was dealing with a situation where the parent came in and found the child dead. And I'd say one of the things we did process through, as my previous panelists mentioned, it was the survivor's guilt. It was her feeling like, oh, I should have known. Why did I let him go to Mexico? And one of the things I did with her was I really challenged that thought, utilizing Socratic dialogue, and at the same time validating what she was feeling as a normal response to trying to make sense of an unexpected death. And so that was one of the hugest things I've seen with a lot of my clients. It is that, well, how come I'm still here and they're not here? I think that is a huge, and also just the readjustment piece, having to take on roles that they're not accustomed to. Just having that acceptance piece of, wait a minute, life is different, whether I like it or not. And just that whole adjustment period, which I can say from personal experience, that is very difficult. So those are three of the hugest issues that I have seen with my clients, as well as even just the grief affecting the whole family dynamic, especially the marriage. And those are the issues that I have helped some of my clients process through.
I believe the other two panelists answered beautifully, but I will just add, just to piggyback off of Ms. Fulton, in terms of the family dynamics. I work at a grief center, so I'm seeing and doing grief day in and day out. And I think one of the biggest things that stands out for me personally is we know that grief does not just, a death loss does not just affect one person, but it affects the entire family unit. And in my experience, my personal experience, in what I do on a daily basis, is that a lot of times the grievers are grieving very individually and isolated to a certain degree, because a lot of times the children are trying to be strong for their caregivers, because they, you know, in the example of Isabel saying, you know, well, I'm grieving too, but I need to be strong for my mom because this was her spouse, and mom's trying to sometimes be strong for the child. In my experience, a lot of times families don't talk about their grief experiences with one another. Those are conversations that are difficult to have. And I think that everyone's trying to navigate and so to speak, not rock the boat for the other, and create some type of stability or homeostasis at home. And so it is very isolating, even in homes where everyone was impacted by the death loss. And so for me, I think it's just really bridging those conversations with those that are affected. I know that this client in particular has multiple children. They're not all locally at home, but finding a way that they could be begin to have those conversations, that they know that they're not alone, I think really just validates that experience for one another. That can be done through support group, but I think the family unit is so important. And often that support, although they want to be there for each other, they don't know how to facilitate or begin that process. And so I think that's just something that stands out to me in my experience.
Okay, all beautiful responses. Thank y'all. Okay, on to the next question. What role is there, if any, for antidepressants, anti-anxiety medications? If there is a role, what would you prescribe? For how long? And how would you follow her? So I guess like monitor her.
So obviously I'm not a prescriber. However, I feel like I could wing it through osmosis and in proximity to psychiatrists. So if I was a prescriber, I am a Zoloft stan. I love Zoloft. I think Zoloft is awesome. I think that probably starting her off with a low dose. I'm talking like child starter dose of 25 milligrams of Zoloft, or maybe even it depends. It seemed like most of her symptoms were depressive rather than anxious. But let's say if she had like comorbid, she was a little mixed, probably Wellbutrin, which is usually used, I want to say at 10 milligrams, it's either 10 or 50 milligrams as a starter dose, to help with both of those. If she was having issues with sleep, maybe a PRN of trazodone, low dose, like 5 milligrams. If I was the psychiatrist, I would monitor her at every 6 week increments. Those medications I listed are medications that need to be titrated, right? Meaning they need to be built up kind of in the system. When you are also prescribing, you don't want to prescribe a whole bunch up front, up fast, right? I would also ask, has she ever been on medications before? If she have, did she like them? Did they work? What are some funky side effects did she experience? And ask her if she's even willing to take those medications, right? A lot of times, again, at the VA, there's this apprehension, there's a stigma behind mental health in general, but there's even more of a stigma behind medication, right? I don't want to be dependent on something to help me be functional. I don't want to have to take something every day to be upright. When I have that kind of resistance, sometimes I'll say, like, would you say the same thing about a type 1 diabetic? That the type 1 diabetic is dependent on insulin to keep them upright? Or would you say that this is something that they need to become a functioning human being? I would take it at 6 months, right? After the 6 month, let's review. How are you feeling? Do you feel like the medication has helped you? Should we tweak here? Do we need to raise here? What are you noticing? And kind of going from there if I was a prescriber. But since I'm not, I would defer this to either a psychiatric NP or a psychiatrist. But if I was, that's what I would do.
I'll go next. If I was a prescriber, I would say a prescriber, or as an LPC, I would explore her beliefs around medication and see if there are any stuck points, whether that be either her experience or a vicarious experience, or someone in her family maybe had been on medications, and for whatever reason it wasn't a good outcome. I would definitely explore that. I would definitely also provide some psychoeducation, excuse me, on the side effects of the particular medications. And as the previous panelist just said, I would, prescribe trazodone, but I definitely would not begin with a high dosage. I would also, again, make sure I'm having that ROI on file, speaking with her physician, also kind of just looking at her medical history, if there's any pre-existing conditions. I definitely do that. And I'm, again, in my mind, I'm thinking and talking, so bear with me. And so thus far, those would be some of the ways that I would approach it as a prescriber. I would also just emphasize to her, she has autonomy, that at the end of the day, this is her choice, not mine, so that she doesn't feel like she's being forced or treated as if she doesn't have the ability to think for herself. I definitely will find a way to honor that autonomy and promote collaboration, and ensure that I've also built a good rapport. And so those are some of the steps that if I were a prescriber, and clearly I'm not, so I would definitely refer out to a psychiatrist. I would definitely, again, making sure that ROI is there. If she hasn't had one, get a psych eval. And so those would be my steps, both as a prescriber and as a LPC.
I don't think I have much more to add. I think both the panelists ahead of me answered really well. I think the only thing that I would add is that I would just provide some psychoeducation to the client in particular, that because there often is apprehension to take a psychotropic medication, that the benefit to taking medication is that it's supposed to enhance the work that we would be doing in therapy. So being able to alleviate some of those symptoms so that she could be more receptive to what is discussed in therapy. The intention with the medication is to alleviate the symptoms, but it doesn't necessarily treat the root cause of why she is in counseling, right? And so processing the death loss is still something that is necessary, even if the symptoms seem to decrease. And so just providing some psychoeducation on how that plays a role in her treatment would be important for me.
Okay. Thank you all. And I know we kind of touched on the next question, but I wanted to open it up to see, did anyone have anything to add? Like, of when would you refer her to a psychiatrist, if ever? I know we kind of already touched on that.
I may
Oh.
have missed this. Oh, sorry.
Oh, I didn't mean to interrupt you.
I'll be brief. I may have missed this, but I don't recall seeing how long after the death the child is seeking service, the daughter is seeking services from mom. I may have missed that.
6
6
months.
months. Okay. I think that would just be a conversation, as was mentioned earlier by Ms. Fulton, expressing to her that this is a collaborative relationship and that she does have autonomy. And so I would probably have a conversation early on about you know, what her thoughts are on the matter, and then taking it from there. But it sounds like, especially if it's been 6 months, that maybe there is an opportunity for her to see whether that would be beneficial.
Okay, Ms. Fulton, did you want to jump in? I know you had unmuted first.
Yeah, I had unmuted. As far as referring her to a psychiatrist, and I was kind of looking at the fact that it has been 6 months. I definitely wouldn't be in a rush, because what I wouldn't want to do is pathologize what are common responses to grief, and at the same time not ignore. Because I do recall in the story they're talking about just the loss of appetite, which again, in response to grief, is very normal. I'll definitely include some measures to just continue to monitor. Okay, is this sadness increasing or decreasing in intensity? Is she continuing to experience loss in appetite? And for me, I think measures are very important, as well as just honest conversations. So that's all I wanted to add to that question. Thank you.
For me, I currently where I work, we follow an interdisciplinary team model, right? So all veterans are kind of divided up into different teams. So this would definitely be a case that I would present during our morning huddles and just kind of get some feedback. I want to respect the client's autonomy in their decision-making process, but also keeping in mind that if I feel like there's a clinical need, I may kind of reach out and maybe encourage her. It would depend. If I feel like her symptoms are intensifying, like Miss Fulton and Miss Waddle said, like if the symptoms kind of intensify and kind of persist beyond what I feel like therapy is helping, right? Therapy to me is a very big placebo effect. It works because you believe it does, but if there's something that's hindering your belief that is more psychiatric in nature, I feel like it's important to kind of loop people in. Even sometimes when the veteran may be apprehensive, or the client may be apprehensive, right? Of like, I know this is something that you were kind of worried about, but, you know, not really wanting to do, but I think it's time that we kind of tap in someone else. So if things, like my other panelists have said, if things persist and continue to increase negatively, then we should probably consult.
Well, again, I'm gonna pass it over to Kelsey for the last two questions.
Okay, So, based on the information provided, what diagnoses would you give Adrian, and what would be the symptoms within the case that support your diagnosis?
I'll begin if it's okay with the other panelists. As I was just going through the DSM-5 in my mind, I would diagnose her with adjustment disorder with depressed mood. And the reason why, again, I would choose that diagnosis, it's a soft diagnosis. And let me look at that. And then the symptoms that would support that diagnosis for me is, again, the loss in appetite, the not desiring, not wanting to clean, self-isolating. And again, my brain is trying to recall the other facts from the story. And those definitely would be the symptoms that I would utilize to support this diagnosis. Because at the same time, I don't want to pathologize what are common responses to grief. And the other thing too is that, the fact that she has lost a partner of so many years, and now she's having to deal with these roles that maybe she hadn't had to deal with before. And just that whole idea of this is a huge life transition. So I would keep that in the back of my mind as I'm making my diagnosis. But for me, the fact that it's impairing her daily functioning, and those would be my reasons for my clinical, would be my clinical reasons for my clinical justification.
I think I would probably go with prolonged grief disorder because of the compound grief, right? In the first scenario, she mentioned that she's already lost her husband in Korea. She lost her daughter Anne to the motor vehicle accident, and she doesn't know if she can handle another grief. Considering that those happened early when she was in her teens and 20s, and now this recent loss has persisted for 6 months. It does seem like she's got some of the criteria symptoms, right? Struggling to reintegrate to life, difficulty accepting death, intense emotional pain, so much that it's affecting her ability to function daily. Would probably be a rule out. I would do maybe a rule out for PTSD. Me personally, I'm hesitant to give out a PTSD diagnosis for grief. The symptomology has to be really specific. That's because of my background in PTSD. So there are certain things that I'm looking for before I die, because that's a heavy diagnosis, right, to give someone. So I'm usually reticent to give PTSD diagnosis without some intense criterion A. But I think prolonged grief disorder is appropriate, with maybe even a rule out, maybe not PTSD, but acute stress disorder, right? I know that's a little bit, the criteria for that is 30 days, and I know she's kind of been at 6 months, but that's what I would kind of do a rule out for, and maybe even do an assessment or two, right? If I'm feeling like there is a need for rule out for trauma, I'm going to give her a PCL5, either probably a monthly, or depending on how often I'm seeing her, probably a weekly, just to kind of gauge where she's at. But the first that comes to mind is the prolonged grief disorder.
I think for me, it would just depend the setting that I would be seeing this particular client in. I think Ms. Fulton touched base a little bit on being careful to not pathologize this natural human reaction. The responses that she is exhibiting, I think, are natural for a widow. She was married to him nearly 50 years. And so these are natural grief reactions. And I'm fortunate at this time that the facility where I'm at, we are a nonprofit. And so we provide the grief support at no cost, which does give us some leeway to not have to diagnose or bill insurance for the services that we provide. So I think it really just depends on the setting. It does make me a little uneasy to provide a diagnosis if not necessary. Now I understand if you're billing insurance, that would be necessary. And I would probably go with something like Ms. Fulton mentioned, adjustment disorder, maybe with depressive symptoms, and then just kind of monitor that for her as we keep working together.
I could find my mouse, it wouldn't work. Okay. Thank you, everybody. Those were all great answers. Last question for our panelists today. What other formal or informal assessment might you use in your session to support your diagnosis?
I'll go first. To support my diagnosis, I would definitely do the PHQ. I think that's very important. And also one of the things I do with all my clients across the border is the ACEs, because that just gives me a snapshot and an understanding of some factors that may be I struggle with that word, y'all forgive me, that may be compounding pre-existing grief responses. I would definitely do a Q9. And for right now, and there's another one I would do, and just I cannot recall it right now, but it would definitely be at least, I would say, 2 to 3 measures, just to ensure that there is adequate assessments in place, as well as pulling from the DSM-5.
Again, VA. So we are very evidence-based, practice focused, right? All measures are monitored and the data is quantitated. I give each of my clients every single time I meet with them what I call the works. It's got the PHQ-9, it's got the GAD-7, it also has the PCL weekly for my trauma clients, and I also do a CSRE, which is a suicide background. There's a suicide assessment, a CSR, I apologize, is the screener, and then if that screener is positive, then a comprehensive, which is the CSRE. So those are kind of like the blanket assessments that I'm always kind of doing. And then I am someone who relies on my clinical judgment almost indubitably. I feel like my background and my experience, I feel like when you've been in the field for a little bit, and I feel like you guys will be able to test this, there comes a time where you can feel, what you're looking for, especially if you're specialized in that. And so for me, it's personality disorders. I can almost, now I never diagnosed without obviously some evidence to support that, but sometimes I feel like I can feel a diagnosis. So that, and then I use the assessments and client report to kind of, what I'm always looking for is to disprove my thought, right? I don't want to just focus on proving myself right. I want to prove myself wrong. And then if I can't, then I kind of go from there. So again, the assessments that I use are going to be the depression screening of a PHQ-9, which is a bit more extensive than the PHQ-2, a GAD-7 for anxiety, the PCL for trauma focused, and then a CSR and a CSRE for suicidal ideation.
The same, I think the PHQ-9, I was also thinking the CSSRS for suicidality. I would probably throw in also maybe like a brief cope, an assessment tool to get a better idea of what her current coping styles are and opportunities for that. So also leaning in a little bit more on this, just kind of a strength base. I know that's not necessarily to affirm the diagnoses, but that was probably another assessment that I would utilize in addition to some of the ones that were mentioned.
Okay, thank you all for participating in our case study and giving us your background and experiences in our panel discussion. Today, that's all that we have for you. Are there any questions from our students before we get ready to take a break and go on to our training? Any questions from the students? No? Okay. Well, if there's no questions, thank you all. Thank you, ladies, for coming. Thank you, Miss Siarra. Thank you, Miss Fulton and Miss Waddle. Miss Waddle will stay back because we are about to have a training from Miss Waddle on grief and loss. But we greatly appreciate everyone showing up and our students for being here. Let's all give them a round of applause and a thank you in the chat. Thank you again for coming and participating in our panel. If you do have any questions and you're shy, throw them in the chat. And we can also just send them to Miss Fulton and Miss Siarra Stokes, which, fun fact, me and Siarra went to the same master's program. So she's like,
Yes, Kelsey's my friend.
so just fun fact. But so if you guys have any questions, please just put it in the chat or email us, and then we can also just send them to Miss Fulton, Miss Siarra, or Miss Waddle, okay? We can have a 15-minute break, everybody, and so about 10:18, we can come back, and then we will give Miss Waddle the floor to give us the training on grief and loss. But last but not least, let's remember to have our cameras on so that we can give Miss Waddle the full attention that she's training us. Okay, guys. So be back at 10:20. We'll do 10:20. I gave you an extra minute. And thank you again, Miss Fulton and Siarra. And we'll be back. Okay. Thanks.
Hi, thank you.
Thank you.
All right, guys, it's 10:20. We can come on back. Okay, so again, we have Miss Cindy Waddle with us here to provide our training. But before we get started, I wanted to see, if you wanted to introduce yourself, tell us a little bit more about um, like what you do and the population you treat.
Sure. Is everybody able to hear me okay? Yes, awesome. I appreciate you all turning on your cameras. First of all, I hope that we can make this dynamic and engaging, and that by interacting that you will have a better learning experience. So that's my hopes for you today. Yes, my name is Cindy Waddle. I am a LPC, also a registered play therapist. I am in the Rio Grande Valley. I work full-time. I'm the counseling supervisor at the Children's Bereavement Center, Rio Grande Valley. At the Bereavement Center, we specialize in working with youth who've experienced a death, loss of a loved one. We do provide support ages 3 to 24, along with the caregivers of the clients we are seeing. I also do some work on private practice as well. And so I am happy to be here with you all. I am curious to know, is everyone in attendance? I'm presuming part of the university or part of the counseling program. Are you all graduate or doctoral or a mix of both areas of study?
Everybody is a master's program, and then we do have some clinical psych students as well.
Perfect. So everyone here is a student. Well, I hope that you all feel comfortable sharing from personal experiences, asking questions. I was asked or tasked with providing something for you in terms of focusing in adult grief. I try to keep to the basics. So this is more of a grief 101. If you have more advanced questions, or if you feel this is too introductory, let me know. I'm always happy to pivot or move our dialogue in a different direction. I believe I may need permission to share my screen. Normally, my presentations are very experiential. I like to do a lot of hands-on activity, and so we will do our best to navigate virtually. Okay. All right, so a little bit about our training objectives for today. We will discuss a little bit on grief myths and just gaining awareness on the different types of grief that an individual may experience. We'll discuss the multidimensional aspect of grief and how it manifests in different forms. I will provide you some information on factors that influence the grieving process, including common models that are used in grief, and really dive a little bit deeper into Warden's 4 tasks of mourning. That was referenced by one of the panelists earlier this morning. That is the model that I lean into the most. And so I'll share a little bit about that and then provide you some interventions that you may be able to take away with you to add to your toolbox. So I'm going to start with just a little bit of a discussion if you want to unmute or if you want to type in the chat. But I'm going to invite you to finish the sentence here. So talking about death is, and what is the first word that comes to mind for you? So if anyone feels comfortable saying that out loud or typing it in, and we'll wait for some of the responses to come in.
Difficult.
Difficult.
Avoided.
Avoided. I'm reading in the chat. Hard, serious, challenging,
Taboo.
taboo, uncomfortable, sad. So mostly unpleasant experiences is what I'm reading, right? I didn't see, you know, anything in terms of it being anything other than that. I think that is the initial reaction when we think about death in general. I think our culture, many of our communities, it's something that is an uncomfortable topic for most. We do receive graduate students at the facility or the center where I'm at. And a lot of times when I'm interviewing graduate students like yourselves, a lot of them will share, I'm not sure if I have the capacity to do this work. Grief work seems really difficult or it seems really heavy. And there is some apprehension from some therapists to work in the area of grief, death, and loss. From my personal experience, I think it is really rewarding. It can be heavy work, but it's also really beautiful to see someone go through that journey and come out on the other side. And so I'm going to invite you to shift perspective because the change happens with us, right? And so if we can normalize these conversations and feel more comfortable with it, then I think that we open up more space for grievers in our community. So I normally, if we were in person, but I did leave this here because I think that this is a good, just a little icebreaker. It's something that you may be able to utilize with your clients. And I'm going to pause really quickly here. I don't know, maybe I'm going to close the screen so that I can see everyone. Either a show of hands or if you want to raise your hand on your Zoom. How many of you are currently seeing clients or in the phase of your graduate program where you are already doing some client work? All right. Most of you. All right. Wonderful. I'm glad to hear that. I know I can think back to when I was first doing when I was first starting counseling services and seeing clients for the first time. It was, I think that was one of the most difficult things for me was trying to find resources that I can bring into the therapy room. So I tried to integrate some of that in my presentation so that you have a few of the takeaways. So let me get back to my... Are you able to see the presentation again? Yes, awesome. So this is a little exercise that I like to do with clients and also in my presentations, a little icebreaker. So I do have here with me just a little basket of trinkets. These are things just random odds and ends, things that I find either at home or in the office. And I like to pass, if I'm in a group setting, I like to pass the little basket around and I will invite the participants to select an item that represents a memory that they have with their person that died. And so we'll pass this around in a group perhaps and have everyone select an item. Sometimes I may just do that in the room or the space that we're working with. I am fortunate to be at an expressive arts facility. And so a lot of what we do have a lot of different art, Sientre and different interventions that we can utilize. So there's usually something that they can find in the room that they can utilize. And so this is just a little icebreaker. Sometimes I may do this alternatively with just a little container of beads. I have just a variety or assorted beads, and I will pass just a little bowl with beads, and I will ask participants to look through the beads and select one that represents something about their person that died. This can also be done on an individual basis, and I find that this is just a good icebreaker to introduce their person and also just create space for conversation and storytelling. So I am wondering if there's anyone that would feel comfortable looking around the space you're in, and if there's anything that you might see. And of course, I know that this is being recorded. There's many folks on here, so please share as much or as little as you feel comfortable. And if no one feels comfortable participating, that's okay too. But I am curious if anyone's willing to try to just look around your space and see if there's something in your vicinity that reminds you of someone that has died, and if you would feel comfortable sharing just a little snippet about what that object might be. We'll hang out a little bit and see if anyone would like to share. You can type that in the chat or just unmute and share a little bit.
Go ahead.
I want to participate, but I can't just because I personally don't know anybody that has died. So yeah, I just wanted to say that.
That's okay, thank you.
So I have two things. So I recently, about a year ago, one of my uncles passed away. And so when he passed away, my parents, or my mom, because it was her brother, were able to so he wanted to be cremated, so we cremated him. And so we have like a necklace that we're able to put like a little bit of his ashes, and so we can carry him everywhere we go. And then there's another thing that reminds me of a picture. When I was little, he drew a picture with my name and had all designs on it. So those are the two things that remind me of my uncle.
Thank you for sharing that.
Thank you.
Is there anything in the photograph that I have here? I know they're kind of piled on each other, but is there anything in the photograph that perhaps might trigger a memory or an experience for someone? And if anyone would be willing to share based off the items on your screen.
I don't, not out of the items, but I have a picture that I keep. It's on my wall behind me, but of my brother. He died 25 years ago. And the picture is so like warped. There's pieces like of it coming off because it's so old. But it's the only one that I really like have of him and me and my mom. So I've had that and it just like stays with me from place to place.
Yeah, that's an object that's really meaningful for you. Thank you. Thank you for sharing that. I find that just having this little sorted basket is really helpful. Sometimes there are memories that the individual may have not thought about in a really long time. So just share a little bit about what's in my basket now. I have like just a little artificial plant. I've got a candle, a stone, a mini camera. I've got like a baby spoon. It really is just mix odds and ends, a pill bottle. And really the idea is to just spark a conversation. Sometimes I have a playroom. Sometimes I'll just go in the playroom and I just grab random items. They have no significant meaning for me. It's not intentional in any way, but sometimes it will spark really meaningful conversations. I usually throw in, actually I have some here, like Monopoly money, and sometimes they may share, well, remember when we were kids, we would sit around the table and play board games, or I throw in a lot of play food, and sometimes they'll talk about memories they had in their childhood. And so it doesn't have to be anything special or magical, just trinkets, things that you might find around your home. I usually have a little basket. It's not something that I use just specifically as an icebreaker or as an opener, but sometimes you could utilize that in different ways. For example, if is there anything in the basket that represents a safe space or a happy memory? And that is something that you can utilize as a resource or an anchor when your client is dysregulated. And so I think that is just a good way to break the ice and start to build that rapport. And so I appreciate those of you who shared with me and shared with us a little bit about what some of this meant to you. All right. I lost my presentation in my screen. 1 second. Sorry.
In the meantime, while you look, I could just share like
yes.
one of the things that like for me reminds me of the scent of like certain flowers. Like when I was little, I was at a funeral for my cousin, and I remember that scent, and that stuck with me. So like in the future, or whenever I smell that, it takes me back to that. It's like a certain scent. It's like of the flowers I'm thinking that they bring and stuff.
Thank you for sharing that. That is also something that is helpful to bring in the different senses. Sometimes I will utilize the sensories in the work that I'm doing. So we'll go through the 5 senses and discuss some of those memories. I appreciate you sharing that. All right, I think I'm back. Here we go. Are you able to see the presentation? Oops. Okay. So most of us do have some type of grief experience, who have experienced a significant type of death. Sometimes that is a profound and meaningful experience. Sometimes it's something that maybe we have encountered or experienced either vicariously through a friend or family member, or we've experienced a death loss of an individual who maybe we weren't very close to. And so sometimes we take from our grief experience and try to understand or empathize with the griever, although we do know that every grief experience is different and unique to the griever. And so something that is sometimes helpful when working with grief and loss is just kind of reflecting on what your personal experience is, what you're bringing to the table, whether those are biases, beliefs, or approaches, and just being aware of what that looks like for you. And so I think that that's just an important part of being a helping professional, but also just coming in with that frame of mind. One of the things that I hear often with graduate students and the interns that we work with is that a lot of times they feel like they worry that they're going to make things worse or they're going to say the wrong thing. And I think that that is a natural response for someone that isn't practicing for the first time. But I always like to say that if you can come in with intention and really come into the space to support the griever, that this is not like a checklist that I'm just, here to get my hours, but that I'm really here to hold space, and that you are doing this with sincere intention, that I think that conveys across any anxieties or fears or worries or lack of skills, that it really does go a long way for that griever. They want to be seen, felt, and heard. So I'm struggling with my Zoom. I don't know what is happening. I'm not able to see you all. So I'm going to defer to our leaders or co-hosts. If anyone's raising their hand or chat, it seems to have gone and lost in my screen. Just let me know. Feel free to interrupt me in case anyone has any questions, as I can't see that at this time. So talking a little bit about grief myths. It's a common myth that we have that I often hear is that grief only happens when a loved one dies. And that is not always true. There are definitely many forms of grief, and there are many types of relationships. Often when we think about grief, we think about a profound relationship, a profound loss, whether that was someone that we were really close or had an intimate relationship. But many times I've also encountered grievers who are experiencing the death loss of someone they didn't know, or of someone that they had an ambivalent relationship with. So for example, I know our focus today is on adults else, but for example, I have had the experience of working with individuals who experience the death of maybe a sibling who died before they were born, or the death of a parent that died when they were still infants or toddlers and they don't have a recollection or a memory. That does not exclude them from that grief experience. That grief is still there. Sometimes it is more the grieving the loss of that relationship. That is what is their processing. Grief should resolve after a certain period. Grief, some of you may have heard, grief is a lifelong journey. We do not, grief never ends. And there is a period of time where we adjust to the loss. However, it does not end, and there is no expectation. Often grievers talk about feeling rushed through the grieving process, where they share that many times they just begin to internalize that grief experience, because after a certain length of time, they may get comments from well-meaning individuals in their life who say, you know, it's been a year, it's time to move on. You know, it's been 6 months, it's been 5 years. And so there is often an expectation from the non-grieving support system that shows or indicates that they are struggling with that death loss experience. And then we know that, or there is the distinct stages, and I will talk a little bit more about the different grief models, but that idea that grief is linear, or that we go through stages, that is not the case, and we will explore that a little bit further as we talk about the different grief theories. Grief has an endpoint. That is also false. As I mentioned, grief is a lifelong journey, so we learn to adapt and work through that grief experience. Another grief is just as intense, is just an intense form of sadness. When I'm doing these types of trainings, I often will ask, you know, participants, what is the first emotion that comes to mind when you think about grief? And the great majority of individuals, the first thing that comes to mind is the word sad. And grief is not just sadness. I think that is the most common reaction, but there are many different forms of expression that come with grief and emotions that are resulting from that grief or loss experience. Advice is the best way to help someone who is grieving. No, that is not always the best approach, and there are many different ways that you can support a griever. Again, we'll talk a little bit more about that as we move through the training. Grief and mourning are the same thing. They are not. There is a difference, and I've got another slide there. If you are not crying, you are not really grieving. That is also a misconception. Again, it goes back to that idea that grief is only sadness, and that the physical action of crying is representative of the intensity of our grief experience. And that is false. Time heals all wounds. Grief gets better over time. The amount of times I hear this from grievers who will reference to that, or even non-grievers who will say, you know, in time things will get better. I've heard grief heals all wounds. I like to say that proper attention over time is what helps. That's no different than if we had a physical wound, if we broke our arm. It may heal in time, but what's really going to make the difference is proper attention, right? If we can give proper attention to that wound, then it heals in a healthier manner. So time is not indicative or the only factor in that healing process. And the first year is the hardest. That is something that I also hear with grievers. That may be true for some grievers, but that is not a true experience for all grievers. Sometimes the first year is not the hardest. Sometimes it's the years that follow after that. Are there any other griefs that, grief myths that any of you have heard that are not listed on here that you would like to share before we move forward? Or questions or comments on this? No? All right, we're going to continue. Sorry, I'm really struggling. I'm going to stop my screen share. I don't know what's happening. I'm really struggling with seeing this presentation. All right. So what is grief and what is bereavement? Grief.
Somebody put something in the chat.
Yes.
They said moving on means forgetting about the person is a myth.
That was
Yeah.
me. Yeah.
Yeah, that is one that we definitely hear a lot. And sometimes that there are some cultural pieces there where sometimes there is some incongruence with wanting to move forward and feeling disloyal to the deceased because we're moving forward without them, or feeling this need that we have to let them go to move forward. I like to say, or a phrase that I find myself saying, that just because someone's life ends doesn't mean that your relationship with them ends, right? And so that continues over time. The relationship, we reinvest in that relationship in a new and different way. So, thank you. I think there's something else in the chat. I was always told it's almost disrespectful to move on and not think of the person basically daily, like you forget them and don't care about them. Yeah, that is also, I think, part of that cultural piece of feeling that we are moving on without them, that we're forgetting, and that they are not significant individuals in our lives. And I've also heard the opposite, especially with the Hispanic community. Sometimes I've heard individuals say that we're not letting their soul at rest because we're continue to bring them up and not let them go, right? So there's, I think, a little bit of both, depending on the personal beliefs of the individual. Thank you. Okay, so what is grief and bereavement? I mentioned just a few minutes ago, they're not the same thing. These are often used interchangeably, but they do have very distinct meanings. So grief refers to the personal experience of the loss. The way I might explain this to a griever is this is what you feel on the inside. This is unique to you and your experiences, and it does impact your ability to work through those emotions. Mourning is the expression that occurs after a loss. So this is often influenced by our cultural beliefs, our customs, rituals, and practices that are specific to that individual. And so the way I might explain mourning to a client or a griever is grief is how we show or express our grief experience on the outside. So that might be setting up an altar in our home. It might be doing gravesite visits. Sometimes there might be individuals who have custom t-shirts or decals in their vehicle that say in memory of. Those are all forms of mourning or expression of mourning, where we're outwardly sharing with others our loss experience. And then bereavement, this is the period of time in which we are adjusting to the death. That does not mean that grief ends. And so grief, I truly believe grief is a lifelong journey, but there is a period of time where we are adjusting to that loss experience. Typically those are marked by like what we're taught in graduate school, which is, impairing the daily functioning. This is where the loss experience is interfering with their ability to engage it's at school or at work, or it's interfering with their relationships or daily functioning. So in our case study from this morning, that individual would be an example where she is still in a period of bereavement. Now we are no longer in bereavement when we have adjusted to that loss. And so similar to what Jess mentioned in the chat just a few minutes ago, this is where we continue to move forward. We may not always think about that death loss experience or that person or we can find joy and pleasure in other items, and we're able to reinvest in our life. So that's would be an indication that the person is no longer in a period of bereavement. So grief is what's on the inside, mourning what we express on the outside, and bereavement is the period of time where we adjust. So, oops. There we go. So grief manifests, it is a multi-dimensional experience. Grief is not just emotional. That is typically our first thought when we think about death loss, is that, oh, how sad, how tragic, how difficult that must be. And the emotional component is definitely a big part of that grief loss experience, but it's not the only reaction. So grief is a very physical experience as well. So that might look like a lack of energy or too much energy. I'm really looking at this on a continuum. So anything on the two ends might be indicative of someone who's really struggling with that death loss. Unusual clumsiness or accident prone. This is often attributed to an individual describing feeling like they're in a fog-like state of mind, feeling like they're just kind of going from point A to point B. They may, a lot of times when I talk to grievers and they are a little bit further in that grief journey, they might say, I don't remember the first couple of weeks or the first couple of months. I don't remember the first year. It really is just kind of a blur. And a lot of times that's the fog-like state of mind. They're not really fully present in that experience. And so sometimes they just may be a little bit more accident prone. I think older adults, we know sometimes will have more accidents or falls. And so those are things that are common reactions for grievers in a very physical way. Forgetfulness and difficulty concentrating, that is something that I hear very frequently, almost with all of the adults that I'm working with, that is something that is quite a challenge for them, especially right after the death loss. Sleep disturbances is also another common physical manifestation. That could be oversleeping, undersleeping, interruption in sleeping patterns. Sometimes there's fears that are associated with the death loss, especially if there's any correlation with their personal experience with death. Appetite disturbances, whether an increase in appetite or a decrease, and then the somatic complaints. Grief is a very physical experience. Sometimes grievers will talk about having frequent headaches, tummy aches, body aches, just aches and pains that are not attributed to a physical or medical condition. That is grief manifesting in a very physical way. And so that is something that we want to explore with the clients and also help them find some relief in that area and help them make that connection between the body and the mind, and what that looks like for them.
Question.
Yes.
So with your last slide of the physical manifestations of grief, I'm wondering, is there since grieving is a lifelong experience, is there a time limit on the physical manifestations of what the client would experience?
Actually, you bring up a great question. So when I say grief is a lifelong journey, if you have ever experienced or know someone who's experienced a profound or significant relationship, the death of a significant person, you're always going to miss them, right? The griever is always going to, a grieving mother is always going to think about her child that died, or her spouse that died, or a child who's experienced the death of a parent. So that is a void that will continue to exist. And there's nothing that I can do as a therapist or that you could do as a helper to take away that absence. So the death loss experience is a lifelong journey because we will think about them. There will be milestones and anniversaries and celebrations that we yearn for them to be a part of. And so that's what that grief experience is like long term. Many of you have probably heard of grief. I'm going to close this for a little bit. Many of you have probably heard of grief referred to also like the oceans of the waves of the ocean. And so sometimes grief it feels steady and it feels calm. It feels like we can manage, like I had a good day. I didn't cry. I didn't, even really think about them or what happened. And so that might be a common experience. And then they say, and then I had a really hard day, or, Valentine's is coming up and I'm thinking about all of the memories we shared and it feels like I'm back at the beginning. And so we want to prepare the griever for that, to understand that there's nothing that I can do that can take that grief experience. What my goal or my vision for you is that you have the tools and the internal ability or the resources outside of you to manage those waves of grief. When you have a difficult day, that you have the resources to be able to manage, because those days will come and your grief will ebb and flow. Now, the manifestations of grief that I'm discussing here would be, I think, more common with someone that is in that period of bereavement. So they're still struggling, they're still processing, they're still adjusting. That's where you'll see a lot of these reactions. Once they're no longer in that period of bereavement, they are adjusting. Grief is more integrated into their daily life, and therefore you will see less of those manifestations or grief responses.
Okay. Okay. Yes, that does. Thank you.
That is a great question. Any other questions? Emotional manifestations. This is again just showing the most common emotional responses to grief. As I mentioned, I think many people identify sadness to be a primary emotional response to death loss. However, there are many, many, many emotions and often co-occurring. Anger is one that I see very commonly. Sometimes it's anger at the person that died. If they somehow believe that they may have prevented the death in some capacity, angry sometimes for dying. Sometimes it's anger at themselves because they feel that they could have done more to prevent the death, or that anger may be expressed outwardly towards someone else, especially if there is blame onto someone else, angry at the doctors that couldn't save their lives, or angry at the person who caused the accident that they died in. Isolation and feeling alone is very common, as I mentioned in the panel this morning. Many times grievers talk about feeling very alone in their grief. And although they may know other grievers, or there might be other grievers in their home or in their family, a lot of times that is not something that's discussed openly. And so it does create this sense of isolation and feeling as if this is an experience that is only happening to them. They talk about feeling very overwhelmed, not sure how to navigate and move forward. Worries and fears is a big one. Guilt is something that I also see quite a bit. Guilt is something that sometimes grievers have. I was thinking about the individual in the case study, and she was a caretaker. Sometimes caretakers experience these feelings of guilt where being a caretaker to someone that is terminally ill or chronically or critically ill sometimes have to devote their entire life to taking care of someone who is sick. And there is often a sense of relief that the person is no longer alive, because that they're able to give their body a rest. That stress has been reduced, and then follows the feelings of guilt, feeling guilty that they feel a sense of relief from the death loss experience. I know it was referenced earlier, survivor's guilt is another common reaction. Sometimes numb. Sometimes there's clients that will come in and say, I don't know how I feel, or I feel nothing at all. I've heard grievers saying, I feel bored. I also see that a lot with younger clients, children especially. it's often boredom because they had shared experiences with the griever, right? My spouse and I used to go and do these activities, or my dad and I used to spend this, Sundays fishing, and now that's not there. And so the boredom is not in the sense of what we imagine typical boredom to be, of nothing to do, but it's really stemming from that separation distress of the person who is no longer alive. Behavioral manifestations of grief. And so with the grief experience, it is also very behavioral based. I think I see this a lot more in children who sometimes don't have the emotional vocabulary or the life experiences to be able to express and articulate their grief responses. And so sometimes that shows in their actions or reactions. However, that is not limited to just adults. Sometimes there is crying, sometimes there isn't crying. The lack or inability to cry is not indicative of their ability to mourn or to be grieving. Sometimes I have grievers who will say, I want to cry and I cannot. They do not have that physical release or the ability to physically release those grief emotions. And sometimes there is a sense of guilt that comes with that. Why am I not crying? I should be crying more. But that's also a natural reaction. Being challenging or overly pleasing, sometimes being too good, right? I always like to imagine or question, is this a typical reaction or behavior for the individual? Is this the type of person that always was challenging or was always over pleasing, or are they compensating or trying to mask some of those grief responses? That might be hyper activity and over engagement in activities or keeping busy. That is something that I see a lot with grieving adults who talk about, I just want to keep busy. That means I'm cleaning the house, I'm taking the kids to school, I'm enrolling them in extracurricular, and that is more sometimes a response of just not wanting to think about it. And so as long as I'm busy, I don't have to stop and think. And then sometimes there is the opposite, right? The feeling like they are not or don't have the capacity to do anything. They want to stay in bed and not engage or interact in life. So you see a little bit of those both. Hoarding is something that I've also seen a lot, and hoarding more so in the sense that it's difficult to let go of those physical objects. It is difficult to we become attached to, especially items that belong to the person that died. Feeling like everything's upside down. Avoidance of trauma or loss reminders, avoiding certain people, places, or things. If it was a restaurant that maybe the family frequented often and now no longer wanting to go there. Those would be some of those behavioral manifestations. Sometimes if there was already pre-existing coping skills, they may go back to that, whether that's self-harming or utilizing substances. I do see a lot of that with adults as well, where they say that there's an increase in substance use or drinking alcohol as a way of numbing or coping, reducing some of those strong grief reactions. So it is also a very physical experience. Grief is also spiritual, existential in nature. That looks different for every griever. Some grievers talk about feeling like grief is brought them closer to their spiritual beliefs, that they may lean into their faith as a sense of comfort and support. And that is incredibly helpful for many grievers. However, we've also seen the opposite, where grief distances them from their spirituality. Sometimes there's a sense or feelings of anger related to their spiritual beliefs. I can think of a client in particular that I remember working with, who said, I did everything that my faith called me to do, from fasting and daily prayer, and really giving everything to their faith and being devoted to their faith, in a way of bargaining for the life of their person who was ill. and that person died nonetheless. And so feeling anger that they really identified as a devoted Christian, and still felt that they were let down, and that their prayers were not heard. And sometimes there is just some really strong feelings of anger that will distance them from their faith. Sometimes it's isolating from spiritual community. Sometimes it's more of the paranormal aspects of that experience. I've heard many stories of grievers who talk about sensing their deceased loved ones, so looking for signs in their daily lives. Sometimes they talk about hearing them or seeing their presence at home, not in a pathological manner to the extent of saying it's hallucinations, but rather really feeling connected to the person that died in that spiritual sense. Sometimes I hear very often grievers who identify their deceased person with objects in their daily environment. So that might be, I remember working with a family who said that at the funeral, a blue butterfly had landed on the client's hand as they were lowering the casket. And so now anytime they see a blue butterfly, it is representative of the presence of that person in their lives, or coming to say hello. Sometimes those are cardinals, I've heard. That's something that is also common. So just feeling the presence of their person in their daily physical world. Questioning the meaning of life and those bigger existential questions. Sometimes it's questioning the meaning of the life of the person that died, or their own life, or questioning the trajectory of where their life is going as they continue to move forward. I'll talk a little bit more about this later in the presentation when we delve into Warden's task of mourning. But this is also something that, I related back to the discussion of the panel discussion this morning. I see that a lot, especially with older adults who are caretakers and have devoted their life to taking care of someone. And when that person is no longer alive, trying to find meaning because they don't feel they have a sense of purpose anymore. And so that's something that is really coming to finding or rediscovering themselves in a new way. They may use fantasy or wish fulfillment as a way of coping with the death. And then, of course, the use of rituals that's a lot of times dependent on their cultural or spiritual beliefs. And so finding purpose and meaning in rituals and traditions is also a big part of that grief experience. And lastly, grief is also a very social. There are social responses that come with the grief loss. So isolation, separation anxiety, that's a big one. A lot of times the separation anxiety is coming from fear that somebody else might die. So as long as I am with you, as long as you text me when you arrive at your location and when you're leaving, or if I can have any way of being a part of that, then that eases the anxiety or fear that something bad might happen to somebody else. Loss of interest in activities they've previously enjoyed, a reduce of confidence and self-esteem. I see that a lot with grievers who relied on those external reinforcement from others. So if you had maybe an adult who received that validation and affirmation from maybe an older parent, right? A dad who says, I believe in you, you can do anything, apply for that job, you're gonna do great. And so that individual may be receiving that external validation from someone who has died. And now they struggle to have that self-confidence, to have that self-affirmation, to believe in themselves because they were obtaining that from someone outside of them. And if that person is now deceased, then that sometimes will interfere with their confidence and self-esteem. We see a lot of conflict with family members. I know we'd like to say that grief and loss brings families together. That's not always the case. Sometimes there are disputes between property. Sometimes the dispute happens very very early on, from how do we honor the wishes of the person that died? Maybe a family member wants to cremate and someone else wants a traditional burial. Sometimes there's battles over custody. And so grief can be very complex in terms of those social relationships and conflict between friends and family. And then there's altered relationships. This is something else that I see very commonly with grievers who will say, you know, I thought my best friend would be there for me in my darkest hour. And it turned out that he or she just did not have the capacity or know how to support me. And so sometimes those strained relationships can be challenging. Grievers come to learn that the people that they thought they could rely on weren't or cannot be there for them, but they may also discover that there are people who they didn't expect to show up and be of support and have. And so sometimes we see some of those altered relationships that can have a bigger effect in how they view the world around them after the death. Any questions so far? All right, so we're going to jump into, oh, yes. How have you handled sibling differences in grief? Yeah, that is a great question. Grief is a unique experience to each individual, and that is something that is a conversation that I like to have with families, right? That they understand that no one person will grieve the same way, and that each relationship with the person that died is different. So in using a case as an example of maybe a father who died, mom might be grieving, but she's grieving the loss of a spouse, of a partner that supported her in a different capacity than that of a child who's grieving a parent. One child may have been really close with parent, and the other child may have had, you know, a difficult relationship with that parent. And so everyone is grieving the death of the same person, but they're grieving it in a very unique way based off their life experiences and also based off the relationship that they had. So it's really just honoring and acknowledging and validating that everyone is grieving the loss, but in a different way, and that there is no right or wrong way. Sometimes there are expectations. Sometimes I'll have parents who will share with me, well, I cry every day, but my child has never cried. Or, you know, I'm really sad and my husband is, you know, appears to be fine. And so there is sometimes this belief that grief looks a certain way. And so when someone displays grief differently from how we're grieving or the norms of what grief is supposed to look like, it can cause conflict or we can question. So I think the biggest thing for me, if I was working with a family or with siblings who are grieving in a different way, is really just kind of honoring that there is no right or wrong way to grieve. I see another question. Do you approach grief therapy differently based on whether the individual has a serious mental disorder, like borderline personality disorder? Grief, yes. Again, grief is a very individual process. It really just depends on the unique needs of the griever, and what they're bringing, what they're manifesting, what is going to provide them some sense of relief. Whether or not there is a co-occurring disorder, I think like any client, you would look at their case individually and identify their history, their life experiences, and I have a slide a little bit further down that talks about factors that influence the grieving process, but there are many factors, and so taking that into consideration would really help us to determine where do we approach, what are the immediate needs of the griever. So moving forward with a type, those are great questions. I appreciate you all interacting and sharing those. So types of grief, there are many different types of grief. When I talk about a death loss, typically that is because the death has already occurred. But there are other forms of grief that may come up. So for example, anticipatory grief. Again, in the panel discussion earlier this morning, the initial case study talked a little bit more about that anticipatory grief. They knew that the individual did have a terminal and chronic illness, and so the family is preparing preparing for that death loss. There is often a misconception that because we know the death is going to occur, that grief experience will be easier or quicker, because we have sometimes I think that there's this misconception that we have time to have closure or to iron out any final conversations or bring closure to our relationship. However, that is not always the case. Grief, anticipatory grief, even though we know it's going to happen, can still be very difficult. It can still be a traumatic experience. So again, that's different to every individual. Delayed grief, this would be a response where the griever does not manifest the grief reactions until weeks or months later after the death. That is also something natural we see. I'll talk a little bit more about the model that I like to utilize, and that is something that we typically will we'll see that there is a delay in the grief experience. Cumulative grief, this would be working through multiple grief loss experiences. So again, in the case study, the individual had experienced the death of her first husband, a child, and then now her second husband. So that would be cumulative, or sometimes called compound grief, and working through multiple death loss experiences. There is ambiguous loss. This is where there is a lack of a closure. That might be an example of someone who went missing. They don't know if they are alive or not. Sometimes working with families of individuals who struggle with severe substance use. Sometimes we have families who have shared with me, my adult daughter struggles with substance use. Sometimes she's gone or missing. Sometimes we find her, living in the streets, and for weeks on end, we don't know if she's alive or not. And then coming back in and out of their lives. Sometimes it's because a person went missing, or they haven't heard from them, or there are other, situations where it is unclear if a person is still alive. Would be an example of an ambiguous loss. And it's really kind of teetering between being hopeful that the person may still be alive, but also struggling with the reality that they may also no longer be living. Disenfranchised grief would be stigmatized death. So that might be suicide, overdose, or some examples of homicide. These are situations where they are not always openly acknowledged, or are not considered to be worthy of a grief response. Things that come to mind for me is one, suicide. A lot of times, individuals who've had experienced the death loss of someone by suicide often talk about not knowing how to approach that, or when people ask, how did they die, that they struggle with responding, because a lot of times the individual on the other end may not know how to respond, or there is some stigma associated with that. Other things that I've seen also are, for example, overdose, death by overdose. There might be this perceived belief that, well, he or she caused that to themselves, or they were asking for it, right? And so sometimes feeling like others don't have empathy for them because of the nature of the loss. If there's an individual that maybe died in the act of a crime, maybe they were committing a crime and were killed as a result of that. Sometimes that would be a type of death that is maybe not openly acknowledged or considered worth grieving. I was speaking to someone after the school shooting, and they were talking about the mother of the shooter who had also died in the act, and feeling like no one was acknowledging her grief because her child was the one that inflicted this pain and hurt to many other families, and feeling like that is not the type of a grief loss that is worthy of considering, because it was a heinous crime that occurred. So those would be examples of disenfranchised grief, and I think it does add a layer of complexity when processing that death loss. Traumatic grief, again, this is perceived grief by the individual, right? We don't define whether a situation was traumatic or not, but whether the individual who is coming to you identifies that to be traumatic. Again, traumatic does not necessarily have to be a violent type of death. It could be even someone who had a loved one take their last breath at home in their bed and still find that to be traumatic. So traumatic is based off their perception of that death loss experience. And then there's the collective grief, and this is where the entire community is grieving a death loss. So I mentioned a little bit earlier, something tragic like a school shooting or another form of loss in natural disasters, things of that nature, where the entire community or a group of individuals is grieving. That could be on a smaller scale, maybe a work environment where an employee died and everyone in that office is grieving. It could be in a school community or a larger community. It is a collective and shared experience. So do a couple of more slides and then I'll give you all just another little break. But I know we are moving a little bit past the pandemic. I hear as more time passes, I hear less and less mention of the implications that the pandemic had in our community. And I'd like to keep this slide in here because I think that it's still worth mentioning. In my experience, as we move further away from the intensity of the pandemic, less and less individuals talk about those families who were impacted by the death loss. I got to see and work with a lot of families where there was great loss. Some of the families that I work with had 4, 5, 6 individuals in the family die within a span of weeks and months. And so that is compounded. I think that was very much at that time a disenfranchised death where people didn't want to be around them. They didn't want to go to the funeral out of fear that they would get sick themselves. And so there was a lot of trauma that came with those types of death losses, and we're still seeing that, but I think less people are talking about it. So long-term impacts, it did have an impact on how those who were affected, how they're grieving. There were higher levels of anxiety and symptoms of anxiety. And I still see that with some individuals who are still very fearful of getting sick or very fearful of getting somebody else they love sick. Increased levels of stress, isolation, that loss of social and physical connections that happened in that period of time impacted greatly. There are some grievers that are just coming to a place where they're ready to talk about that grief loss experience. There was a great sense of loss of autonomy and just in general safety. It felt like we didn't have control over our lives and what we could and couldn't do at that time. It impacted learning and social interactions, and there were many other risk factors. I worked with many families who talked about being limited to having a funeral service for only 7, where they had to really identify who were the ones that would be able to attend a funeral or a viewing, people that were prevented from being able to participate in those mourning rituals. And so there is a lot of complexity that comes with those who've experienced a death by a COVID illness. I'm going to go ahead and stop here, if I may. We can take another short little break, but before we do that, are there any questions that have come up so far?
Yeah, I've had one come up just kind of related to my practice. I've had this client since the summertime, and grief isn't like the main issue we're working on, but it's a pretty big part of like our treatment, our counseling relationship. And I'm kind of curious as to, so my client's spouse had passed away like almost 4 years ago. And it's just like stood out to me and become like more apparent, I guess, within like the past few months that they've like never like stated their spouse's name. And so I was wondering if that was like worth broaching.
That's a good question. I think I will defer back to you if you think it's worth approaching. You know your client best. Would you say that the client is able to openly talk about the deceased, or is that something that they avoid to a certain degree?
I think they're pretty open. Yeah, they're pretty open. It seems like times when I do ask about them, never goes into like, I won't say never. I don't know. I guess to me it seems like maybe there's more details, I guess, that they could share, but they keep it pretty, I don't know. Seems like anytime I kind of go for more depth, I get like just a little bit, and that's fine, I guess. Um, yeah, I don't know. But
Yeah.
I think I think they could be open to it. But again, it's like I don't know if that would be beneficial, if that might be helpful to them with them just like, stating their partner's name, you know.
I'm very much collaborative in my approach in therapy. And so I also do utilize a lot of immediacy if that was something that I felt would be important. And that's for you to determine because you're in that relationship with the client. I don't think there's a right or wrong way to approach that. And I don't think it's also necessary that they have to reference to their name. I've had plenty of clients who've said, my husband used to do this, my wife used to do that, and not always utilize their name. So I don't think that's necessarily in itself indicative of avoidance or preventing them from processing that. But if you get the sense that maybe there is something underlying there, just kind of using those immediacy skills and saying, I'm noticing that this is happening. I wonder what your thoughts are on that. And seeing maybe what the rationale is behind that. It sounds like your client is talking about the topic. If that's not a primary issue, they also may not feel like they want to delve too deep into that because they're focusing on other primary goals that you might have with them. But I wouldn't personally, I wouldn't necessarily be alarmed if they didn't reference to them by first name. I see that quite a bit. I think it would just depend more if you felt like there was something else there.
Okay. Gotcha. Thank you.
I hope I answered your question.
Yeah, sure.
Any other questions? We can maybe take just like come back at 12:05, just a short little break so we could stretch our legs and we'll see you all in a little bit.
You said 12:05?
Oh, I'm sorry. Let me see. I am.
Oh,
I
you
think
muted.
muted. You muted yourself.
I did not mean 12:05. Sorry. Let me see. It's 11. It's gonna be 11:30. 11:35.
Okay. I just wanted to clarify. I was
Yeah.
like,
Thank you.
long
I
break.
appreciate that. Yes, no.
Okay, thank you. All right, guys, so come back at 11:35.
Yes, thank you.
All right, guys, let's bring it on back.
Okay, welcome back. Okay, so we before our break, we were talking about the different types of death losses. I'm going to transition a little bit into factors that influence the grieving process. These are things that I would consider when working with a griever and determining what their history is and what they're bringing to the table as we focus our time on the grief experience. So the first one would be showing the demonstrating, or I'm sorry, exploring the characteristics of the death. So what is the death experience that the individual has is working through? Are there multiple deaths? What are the characteristics of those deaths? And so, for example, the way that the person died is going to impact how we process the death loss experience. There is no one greater or more challenging death experience compared to another, but it does impact how they will process. So whether that was a homicide, suicide, overdose, sudden, unexpected death, or chronic illness will definitely play a role in how we process that death loss experience. Also, their ability to mourn the death. What experiences or opportunities did that person have as they were processing that death? Were they able to attend a funeral or memorial service of some type? I've worked with many individuals who share that they were not able to be a part of that process. You know, our community, my community where I'm at in the Rio Grande Valley in particular, sometimes the funeral may be held in Mexico, for example, and they may not have the capacity to travel and attend. I've worked with the grievers who maybe the person who died was living out of state and they didn't have the means of going or being there either at the time of death or after the death. I referenced to the pandemic and many individuals who didn't have that capacity. I remember working with one family in particular who they were asked by the funeral home to observe the burial from their vehicle. And so that was something that was really challenging for them. And that was in response to the pandemic and minimizing the risk for others. But that does definitely play a role in that process. I've also encountered situations in which we have worked with individuals where maybe it was an individual who was grieving a relationship where it was maybe an extramarital affair and the person does not have or did not have the ability to attend the funeral out of respect for the families, or maybe that relationship was unknown. And so there are situations where an individual may not be able to outwardly or physically attend to those mourning rituals. The relationship with the deceased, I briefly touched on this a little bit earlier. So for example, if they had a close relationship, that is going to impact how they process and grieve, and the separation distress that results after the death. Or was it an ambivalent relationship? Was the person that died a positive person in their lives? Sometimes we see this with cases of domestic violence where there was a tumultuous relationship. Sometimes the person that died was an abusive person or caused harm to the individual. And so there may not be feelings of a sadness there. That's not to say that there isn't grief, but it's going to look really different for someone who had a difficult relationship with the deceased. Support systems and level of functioning. I have here surviving parents, if it's a child or a caregiver or surviving members in the home. What does that look like for the individual? I do specialize in working with younger children, and sometimes one of the things that we do know is that how well a child will do with processing a death is largely contingent on how well the adults in that child's life will cope. And so we know that as adults, we are modeling what is grief and what that looks like, what is healthy and unhealthy. And so we want to really support the adults in supporting the griever. Cultural background, what are their cultural or spiritual beliefs is going to play a role in that. And I would add there also spiritual as well. Secondary losses resulting after the death. So this might be if it was a single income household and that is the person that dies. That is largely going to impact how they adjust to a new environment without the deceased. Sometimes families have to move in into the home of another family, another household. Maybe it's an adult child that has to move in with their parents because they have lost an income. That may result in moving homes, cities, schools, changing jobs. And so there are a lot of secondary losses that may occur. Prior experience with loss, what were those prior experiences and how does that impact or shape their current loss experience? Are there compounded losses that have not been processed? And if so, which one is the client looking to prioritize and focus on first? Their age and level of understanding about the death, their capacity to process the death, not just, as a child, of course, that definitely plays, their developmental age definitely plays a role. But I've also worked with adults with learning disabilities, with diagnoses of or Down syndrome or adults with autism, and what is their understanding of the death and how do they process that. Pre-existing coping mechanisms. Ideally, if they have positive coping skills, they have the internal resources to cope with stress and difficult life situations. Those are definitely going to be helpful in that process. But if they had pre-existing poor coping skills, they maybe struggled with regulation prior to the death, if there was already history of substance use, suicide ideation, self-harming, or other risky behaviors that may increase or amplify in the midst of that grief loss experience. And then, of course, their belief system. So there's a lot to consider. It's not just the death loss experience, but all of the different factors that really come into play. Grief is not isolated in a bubble. It does impact and affect many areas of the griever's life. And so those are all things that would be helpful to consider. Right, so the grief and loss models. So I'm going to briefly cover some of the different models that are recognized in the grief field, but I will spend more time on William Worden and the Four Tasks of Mourning. Those are the models, the model that I personally lean into and is most frequently used by grief professionals. I do always like to start with Elizabeth Kubler-Ross. I think this is the most widely known or referenced to model in the grief world. I have many clients who will reference to Elizabeth Kubler-Ross and the stages of grief. I'm presuming many of you have heard of Kubler-Ross in the 5 stages, which is denial, anger, bargaining, depression, and acceptance. She was a professional who was working with terminally ill patients who were in the process of dying. And so she identified these 5 stages of grief as they came to terms with the reality of their impending death and coming to accept their death. Her work really focused on those who were dying and not necessarily the survivors of a death. So although this is one of the most well-known models, it is not a model that most grief counselors will utilize because it is really designed for those who are dying and coming to accept their death. So this is one that I wouldn't reference to, but with that being said, I don't necessarily correct a client because I have had several who will come into therapy and say, you know, I Googled the stages of grief and you know, I think I'm in this stage. Really honoring and validating the work that they're doing, what they're bringing to the table, and their ability to be able to have that self-awareness and process where they are in that journey. I don't think that it's necessarily right or wrong. Those are still very valid and true experiences for them. But as a therapist, this is not a model that I would necessarily utilize with the client if I was working with them with processing the death of a loved one. So I like to throw that in because it's often misuse in the grief work. Another common model that we utilize is called the dual process model. I think this one is gaining a little bit more traction in terms of how grief is viewed. We usually hear individuals say grief is not a linear process. We don't go from point A to point B and we're done with that grief experience. Grief is a lifelong journey. And so with the dual process model, it is essentially stating that we can oscillate in and out of that grief experience. So on the left of the graphic here, you see someone who is loss oriented. This is intentional grief work. So that might be looking at photographs and allowing themselves to cry. That might be thinking about the death loss. A panelist earlier this morning talked about intentional grieving time. So making it a point to dedicate a time of their day to grieve and process that loss. That would be a period of being loss oriented or grief oriented. And then on the right hand side, you have restoration oriented. So this is working with an individual who is really looking to reinvest in their lives. They're adjusting to this new norm and moving forward in life. And then somewhere in between is everyday life. So the idea behind the dual process model is that we're oscillating in and out between the two. So there would be a period of time where I, as a griever, allow myself to grieve and cry and mourn the death, and then I move into reinvesting and a restoration. And so we oscillate in and out of that. And that really, I think, aligns really well with that idea that grief is a lifelong journey. So we're not necessarily stuck with just processing and being loss oriented, but that we can jump in and out. And I think that that validates that idea that we don't have to always grieve, or that because we're not grieving, that we're moving forward without them, but that there is a time and a place for that. So I do have some of the terminology here, which is the oscillation, right? Jumping between both of the loss-oriented and restoration-oriented. The dynamic process, this is where we suggest that healthy coping involves moving back and forward between the two. It's definitely not linear, but we are giving and creating space for both in our lives. And then the idea of individual variation, that everyone grieves differently and there's no right or wrong way. So I really like how this model validates that piece. Any questions on this? I think that this is just a very natural response for most grievers. I will add before moving forward. In my experience, oops, sorry. There we go. In my experience, a lot of times women will be more in the loss-oriented phase where they really allow themselves to sit in that grief and to mourn that death loss. When working with adult males, I do see more of them really investing in that restoration phase where they're really looking forward to moving forward in life. So I know sometimes there's a comparison of, men tend to move on a lot quicker in the midst of the death of a spouse. I think that's reinvesting greater energy in the restoration as opposed to loss. And so I like to also do psycho-ed with clients and just really explaining both, that neither one or the other is right. I think that there's just finding a balance and creating and allowing space for both. The other model that we often have seen and I think is also very valid is the idea of growing around grief. And so this is the idea that our grief doesn't change, but that our capacity to cope and adjust with the death loss increases. So if you look at the graphic here, grief is the little black circle in the pot, and the circle remains the same. Sometimes people say it feels like my grief is getting smaller. There are some clients who will reference to this, so they'll say the intensity and the pain feels just as big even 5 years down the road, but now I have greater capacity to expand my life, to enhance my life, to be able to manage the big waves of grief. And so I really like this idea that we're honoring the grief, we're honoring the life of the person, that it doesn't get minimized with time, but that we grow, and our capacity to grow around our grief is what really allows us to feel like it is more manageable over time if we adopt the right skills to be able to cope with that. And then we have Warden's 4 task of mourning. This is, I would like to say, in my experience through the grief work that I do, and also a part of the National Alliance for Children's Grief. This is the premier model that most grief centers nationwide utilize. Warden has done a lot of research in grief work, and specifically looking at what that grieving process looks like for the survivors of a death. And so he has labeled these 4 tasks as tasks. He says that it is work that you have to do. It is not linear, or it's not a phase that you just happen to go through, but you actively have to work at each task to progress through all 4. They are listed in numerical, so it's task 1 through 4. But again, like all other models, it is not linear. It doesn't mean that we start at 1 and end at 4 and we're done grieving. I've had clients who come and are very much working through task 4, and it feels like our time in therapy may be short because they're progressing really well, in my opinion. And then a couple of weeks down the road, they come and we're starting at task 1, and then that's when we're really starting to do the work. So it also could be that they can work through multiple tasks at the same time. So it's not linear, but I think that it progresses really well if you follow the task as they are written out. So I'm going to go a little bit more into detail about these. Feel free to stop me if you have any questions. Feel free to type that in the chat. So the first one, task 1, is to accept the reality of the loss. Warden does reference that sometimes this can take anywhere from 1 to 3 months after the death before an individual can really accept the reality of the loss. And William Warden talks about there being two aspects or two forms of acceptance. So one is intellectually accepting the death. This is us knowing cognitively that the person has died because we were present, because we saw them take their last breath, or because we went to the funeral. We know that the person has been buried or cremated. And so we know intellectually that the person is no longer living and can no longer come back, right? We understand the permanency of the death as an adult. But he talks about task one is really more of the emotional acceptance of the death. So often grievers will talk about feeling like the person is coming back, or maybe walking past their bedroom and expecting to see them sitting in their bed. It could be hearing their voice calling them out at their name, or expecting them to see them sitting at their designated chair at the dining table, or walking into the living room and expecting to see them in their recliner. Those are the parts that take a little bit longer to emotionally accept that the person has died. Sometimes I have had adults who have shared, for example, my husband was a truck driver, and so I was used to him being gone 2-3 weeks at a time and then coming home. And so what I do now is I just tell myself he's out on a job or assignment, and that he will be back. That would be an example of someone who's struggling to accept the reality of the loss, because emotionally they are not coming to terms with the fact that the person has died. Some things that may be indicative of someone working through task one. I always see this in films and movies, where sometimes a death has occurred, for example, maybe the death of a child, and the parents will keep the room exactly as it was. They don't, ever move anything, with this idea that maybe they will come back, right? Preserving that as the way it was. I have, a lot of adults who talk about that, right? Their clothes are still in the closet 5 years later. Or a parent who shared with me one time, I have a glass, the last glass of water that they had on their nightstand, and I can't bring myself to move that and wash that cup. So those are all maybe indications that the person is working through task one, emotionally still believing that they may come back, or not fully wanting to accept that the death has occurred on an emotional level. Again, many times that intellectual awareness is there, but emotionally, we still look for them or seek them. If we have a celebration that we want to share, that first thought of, oh, I want to call my mom and tell her, and be like, oh, I can't. So task one is really just coming full face with the reality of the death. Some of the work that we would do with the client in task one is helping them to talk about their story. What is your loss experience? Using words like dead and died. I've heard throughout the morning phrases like passed away. Those are not phrases that I use, and it is best practice in grief work to use concrete language like dead and died. I will never correct a client, but I do model that language. And in my experience, through working with a client, the longer they are in therapy and they're talking about their grief experience, their language will change. And I think that really demonstrates the growth and progress that they're making in therapy. And just really providing space for them to tell their story, to talk about the person in past tense. Sometimes I have clients who will reference to the deceased in present tense. And so we really want to just work through that. The more that they can talk about the death, really helps to solidify the permanency of that death loss. Something that I really like to do in task one also is the separation of self from the grief or from the griever. A lot of times the griever will self-identify as a griever. Oh, you're the kid whose dad died, or you're the lady whose husband died. And so it almost becomes part of our persona, or our self-identity, that I am a griever or I am a widow. And so how do I begin to separate myself from that death that has happened? I I am a person outside of that grief loss, right? And so that might be like something I said, I have my little jar of beads. That might be, you know, select 5 beads that represent you, your likes, your interests, your hobbies, and select 5 beads that represent your person. You know, what was their interest, what were their hobbies, and so that we can begin to separate, because sometimes there is that enmeshment with identifying as that griever and allowing that to be our a representation of ourselves. And so really just owning and validating and regaining that sense of self, I think, is an important part of task 1 as well. Any questions here?
I do have a question.
Yes.
You were talking about the emotional acceptance and that it's difficult for someone to do that. What are some ways to help someone I guess obtain or reach that point of emotional acceptance? Yeah, if you have some examples or just some things that can help, because you said you could be aware intellectually, but the emotional side of it, how can you help that?
Yeah, that's going to take time. You know, Warden referenced, and everyone's on their own journey, but he referenced it that being 1 to 3 months, typically after the death, that really the reality of the death naturally occurs. But some individuals may display some resistance. They may not want to accept the reality, and that happens really often. I was thinking about, as you were asking me about a parent that I was working with whose child died. It was a young adult in college. And this individual was resignated to say, you know, I just want to believe they're in college, and I don't want to accept the reality. And so I don't want to believe anything contrary to that. And so that was a difficult experience because the individual did not want to acknowledge, and in essence was stuck in task 1 for a very long time that we worked through. But what Warden suggests is talking about the death, right? So helping survivors talk about the loss. That might be reviewing what happened. That may be retelling their story. Sometimes we have grievers who will come session after session and retell the same parts of the story. Maybe if they were witness to the death and they keep saying it over and over. I never rush them or, you know, say, this is something we've talked about 5 times already, but rather that's their way of really processing the death. I see that also with children, where sometimes they will share the same memory over and over. And sometimes that's what they need to really accept the reality of the loss. So I would say that 1 is finding either interventions that that you can utilize that allow for storytelling. That might be in the sand tray, create a sand tray about your loss experience. What do you remember about the funeral? You know, can you describe what those days were like for you? You know, what can you tell me about a time where the reality of what happened really hit home for you? So creating space for telling the stories, talking about the person in past tense, giving honest information about the death, using words like dead and died. When your husband died, what was blank? That concrete language really does help. Allowing time for repeated questions. I think is the most important. It's really going to be a lot of storytelling where they can begin to verbalize that loss experience.
Thank you. So yeah, just helping them like talk about it and process it, even if it takes time for them.
Yes, and I think that most, in my experience, most individuals will progress through task 1 fairly early. When I hear things like, well, I just like to pretend they're at work, I like to pretend they're at school, I just don't think about it, I think they're on vacation. Those to me are indications that maybe they really are struggling to through task 1. And so really just creating space, prompts, interventions, activities that you can utilize that just allow for that storytelling to happen. there's comments with this task 1 with the language used from passed away to dead and died. Sometimes people view more concrete language as disrespectful. How do you overcome this aspect? I think that is a fear that people have, but it's something that I have not encountered very much. I would say that doing this for the last 9 years, I've probably had 3 clients total who have expressed concerns about that language. And it's really just having dialogue, what parts of me using dead make you uncomfortable? What would you prefer? But I think it's more the fear of the helper in using that language that is more of a barrier than the client. I think I remember this was years ago, but I was doing an intake over the phone, and a parent had called and asked for services. And so one of the questions that we ask is, when did the person die? Or can you tell me the date of death, or how did they die? And I used a question along those lines, and I could tell that the caller on the other end was taken aback and said, I'm sorry, I'm taken aback. I have never been asked so directly. People tend to dance around these questions. And so to me, I think that was important for me to hear, because many times we're just sampling around it. How do I ask this really difficult question? But it is the reality of what has happened. And the same thing for children. I do a lot of work with children. We use terms like dead and died when I'm talking to a parent or an adult about why we may use that language. I often say that children are concrete learners. They understand the world by the things they feel, see, and touch. And so when we use abstract terms like passed away, how do you quantify that in a concrete way? What does passed away mean? If you tell a child grandma went to sleep, they might be, well, why is everyone crying? Just wake her up, right? We lost grandpa. Well, let's go look for him. Why are we sitting here mourning? And so they need that concrete language. That's how they learn and understand the world. And I think for adults, that same applies. They, especially if they are in task 1, when we're using that language, we are using concrete terms that are really helping us to acknowledge the reality of what has happened. Sounds like idea behind suicide language. Any specific terms? We do utilize died by suicide, not committed suicide. There is a negative connotation with committed. So committed arson, committed homicide. Typically, when we use committed, there is a negative connotation. So the language that we use is died by suicide. If we're using or explaining suicide to a child, I might say something like he or she made their body stop working, or he or she made their heart stop working, would be a concrete language that we would utilize to discuss a suicide. Great questions. I'm going to move into task 2. And so task 2 is to process the feelings, feel the feelings. This seems pretty straightforward, but I think it's probably one of the most challenging tasks for a griever. Most grievers naturally and innately, I think it's just a human response to want to avoid uncomfortable feelings. We don't want to feel pain. We don't want to feel hurt or sadness, or really any uncomfortable feeling, right? And so we try to resist those experiences. I mentioned earlier, a lot of times grievers talk about keeping busy. I just want to keep busy. I find tasks to do so that I don't have to think about it. And so a lot of times grievers will come in and say, this is the only time I grieve. When in between sessions, I don't think about it. I'm a busybody. I try to avoid it. And then I come into therapy, and this is the first time that I really give myself permission to grieve. And I think that that's a very common experience for most grievers. They don't know how to really give themselves permission. Sometimes it's out of fear that I'm going to get stuck there. I don't want to be stuck in my grief. I don't want to be sad. And so I just don't want to experience these uncomfortable emotions. So what Warden talks about is really honoring and validating our personal experience by making space for those emotional reactions. What am I feeling and how can I express that? I think for me, when I'm doing this grief work with clients, it's going beyond the superficial, right? I know you're sad about the loss of your spouse, but what are some underlying emotions? You know, is there a sense of guilt or relief or regret? Sometimes it is those more challenging emotions that we don't feel permission to say aloud because those feelings or emotions might be judged or misunderstood. And so really just creating space for that. Task 3 is Warden talks about adjusting to a life without the deceased. And he referenced to 3 types of adjustments. So one is the external adjustment. This is the day-to-day adjustments in our lives. So for a woman whose husband died, that might be, now I need to learn to mow the lawn myself. For a dad who maybe a spouse died, that he might say, well, now I need to learn to brush my little girl's hair, or learn to cook. So those are just your day-to-day, everyday adjustments to the world around you, new roles, new responsibilities, changes to your daily environment. Warden also refers to internal adjustments. So how does the death affect my sense of self, my self-identity? I talked a little bit about the individual in the case study. So for example, with caretakers, sometimes they say, I have been a caretaker for the last 5 years. I gave up my career, my hobbies, my interests to take care of the sick person in my family. And now that they are no longer alive, I don't know who I am. I don't know what my interests are, what my hobbies are. I don't have friends. I gave up my career. Is that something that I still want to go back to? And so the griever is not only grieving the death, but they're also working through rediscovering a new identity for themselves. That also could be identifying who they are in a family system. If I'm the middle child and my older sibling dies, do I identify as the oldest sibling now, or am I still the middle child? If I'm a twin and my twin dies, am I still considered a twin? And so really just kind of trying to navigate who am I in relation to this death that has happened. And then he also referenced to the spiritual adjustments or existential adjustments of how our beliefs, our values, and the assumptions of the world around us change after the death. Many grievers will talk about realigning and reinvesting in their values. They realize maybe family is more important. Maybe they realize my career is not as important as I thought. I don't want to work as many hours, or I want to spend more time with family, or I want to go back to school because I realized that, you know, whatever that might be, they begin to evaluate their beliefs and their values and redefine that or reinvest in that. Sometimes also the assumptions about the world will change. Examples might be, maybe if it was a death by suicide and they didn't know that the person was struggling with mental health issues, that they may begin to view the world in a different way. They may begin to question things that they normally wouldn't have questioned. I've seen this also with situations where the death resulted because of a domestic violence dispute, where a spouse ends the life of the mother of their child, and the children are left to question, you know, if I can't trust my dad to have kept our family or my mom safe, then I can't trust anybody. Or if a police officer shoots and kills someone, and then, you know, I was raised to believe that law enforcement is supposed to keep us safe, but law enforcement also killed my dad. And so we begin to question all of the beliefs that we had before, our assumptions about the world we had before begin to change in the midst of the death, how the death happened and how that impacts our day-to-day living in the world that we're in. And so Warden really says that task 3 is a lot of work, because outside of grieving and the emotions that come with the death loss, they're also adjusting to a new world, their day-to-day roles and responsibilities. They're adjusting internally to a new version of themselves, and then they're adjusting spiritually in terms of their views and beliefs and assumptions of the world around them. So there's a lot of work that is happening on top of all of those grief experiences. So it's really helping them to create a new normal, to reinvest in their lives, and know that because the life of someone else died doesn't mean that their life has ended. And so how do we reinvest? How do we adjust to all of these changes? And so a lot of what I would do with the client who's working through task 3 is, one, just acknowledging that those changes have happened, acknowledge that they're working and exploring through those new self-identities, their new belief systems and values, and then a lot of problem-solving skills. I think this is very solution-focused oriented task where, you know, what is the challenge? What is making it difficult for you to adjust to this new normal? Can we develop problem-solving skills or integrate coping skills that can help you adjust through these changes? And then dissecting really which of these areas seems to be the most challenging, whether that's external, internal, or spiritual. Doesn't mean that every griever is going to go through all of these. Some may explore or be stuck in one of these areas more than other grievers. And then the last task is to find an endearing connection with the deceased while embarking on a new life. Warden has changed the title of task 4 multiple times. I think this is the last one that he's referenced to, but it's the idea that you reinvest in life, but continue that connection, that the connection and the relationship you have with someone does not end because their life has ended. And so how do you continue to create bonds with the person that died? How do you continue to remember them and integrate them into your daily life? And help them return to a previous level of functioning or something along those lines. And really, I think this is where that dual process model works really well for that task 4, that I have given myself permission to move forward in life, but that I also integrate the deceased into my day-to-day. I think this is where a lot of grievers feel guilt about moving forward, feeling like they are a bad parent or a bad spouse or a bad mother because they're moving forward after the death of that significant person. I can think to provide you, I guess, some context of what task 4 would look like. I remember working with a family who was planning for quite some time a big trip to Disney. It was going to be their first time to Disney, and they were really looking forward to it. And prior to their trip, one of the parents died, and the family was really questioning whether that was something that they wanted to do. They expressed feeling guilty that they were going to go. It felt wrong to go on the trip. It felt wrong to laugh and to play and to have fun, because they were supposed to be mourning. They were supposed to be sad, and they shouldn't have continue forward with those plans, right? And so I think that's a very common experience for many grievers who feel a sense of guilt about moving forward in life. And so as the example with the family who is planning the trip to Disney, we discussed with the surviving parent, what are some ways that you can continue to honor the life of your spouse, the life of the parent to your children in a way that still honors him or her, and also the plans that you had. And so there was discussion about, what was their favorite Disney character. Maybe you can wear shirts one day that include that, so that he or she is a part of their life. I mean, part of that experience, right? Maybe was there one restaurant or one ride that they were really looking forward to? Maybe that's the first one you go to. And so by integrating this deceased person into their trip, it no longer feels like they're doing it without them, but they're doing it in memory of them, right? So every part of that experience now became, oh, he would have liked this, or she would have liked this restaurant, or whatever that might be. And I think that it relieves some of that sense of guilt about wanting to do something without them. Another example is I remember working with an adolescent who was getting ready to have a quinceañera, and her and her parents were planning that, and then before the big party, one of the parents died. Dad died, and the child no longer wanted to have her quince, and the parent is, talk to her. We've already have the venue, we already have everything, we've invested thousands of dollars, and it just doesn't seem logical that we would cancel it. But the child was really struggling with wanting to move forward with that celebration. And so we discussed, in what ways, if your dad had been alive, in what ways would he influence your party? Is there music or a song that he really liked that could be played? Maybe it's his favorite band. Maybe it's changing the flavor of the cake to his favorite flavor, or dad's a Dallas Cowboys fan, so maybe we're gonna do blue and white as the colors. And so in this way, it felt like he was very much a part of every detail of the celebration, that the celebration wasn't being done without him, but in memory of him. And so those are little examples of how one can reinvest that love, that relationship, and really honor. So a lot of what we do in Task 4 is creating activities or interventions, encouraging things that memorialize the person that died.
We have a question in the chat. It says, what about for first-time parents who lose their child? I work at Driscoll Children's Hospital, and this is a common occurrence here.
I think it's the same concept. The 4 tasks are definitely going to apply. I'm not sure if you're referencing to something in particular, but I think that all 4 tasks are definitely applicable. With the loss of a child, there are still ways that they can continue to integrate the memory of their loved one in their lives in a new and different way. So I don't know if there's a specific question, but if it's generally, I think that Warden is still applicable. I don't know if there was a follow-up question.
No. Unless they're typing it in the chat, but I don't see anything right now.
No, that
Also,
answers it for me. Thank you.
And also, I'm not sure if there's still, like I said, I know I'm in the RGB, but I believe that there's also a child life specialist, or there used to be at Driscoll. So those are great resources if there's any opportunity prior to the death to create memorial keepsakes. I think that that's an important thing, whether that is, creating maybe like artwork with their handprint or footprint, that every one of the family can partake in that, so that there are also keepsakes that honor the connections that they had, whether they were short relationships or not. getting to the tail end. Before I move forward, any other questions on Warden and the 4 tasks of mourning? I do want to reiterate, they're not linear. We can go through from task 1 through 4. That is something that we see commonly, and so they may revisit at one point or another. I do like to provide psychoeducation on the task of mourning if this is something that I'm utilizing with the client. I may just provide them an overview of those. Sometimes it's just having a dialogue at a glance, looking at these, which one do you feel best fits with where you're at in your journey, and then making a plan to work through those. I see another question with task. Oh no. Nope, I'm sorry, I was looking at an old question. All right, so if there aren't any questions, we'll continue to move forward. I believe we are slated to end at 1. So what I have for you are just a few tips on what to say, and then I have a few interventions. I think we are on target to finish at 1. What to say to a griever. Sometimes there are no words, so there is no magic formula that is going to take away the pain of their loss experience. And so sometimes just acknowledging that and saying, I have no words for what you're experiencing is okay. There is nothing wrong with that. That sometimes just a reflective statement. And I know I'm speaking to the choir because I'm sure that many of you are very well versed with those clinical skills, but reflective statements. I wonder, the I wonder statement I use quite a bit when I don't have an answer to their questions. And I really just want to create space for them to process their own beliefs. So things that I have been asked, for example, something that I've encountered might be if the individual coming has had a death loss by suicide and they ask, do you think they made it to heaven because my spiritual beliefs or my religion says otherwise? I don't feel that I'm personally in a position to impose my spiritual beliefs, or nor do I want to invalidate their experience. Most of the time when a client is coming to you with these difficult or existential questions that we don't always have an answer to, I feel that a lot of them have formulated their own beliefs, and so they need someone to listen to that, right? And so I had someone who would say, do you think that my brother who died by suicide is in heaven? I might say, I'm not sure, but I wonder what you might think about that. And a lot of times they'll go out and say, well, I've thought about it and this is what I believe. And so putting that back on the client when you don't have an answer for that, or simply saying that, sometimes there are questions that we won't have answers to, and, processing what it feels like to not know or not have an answer. It's okay to say, I don't know. Sometimes we don't know, and we're not expected to know everything. Going back to using language like dead and died, I really encourage you to utilize that language. It is best practice in this type of work, nonetheless. Tell me about, not necessarily, pinpointing any specific aspect, but just having an open conversation. So tell me about how you've been coping with this loss. Tell me about your husband. What was he like? It doesn't have to be a specific, but really just creating space and opening that dialogue. What makes you feel better? Exploring those coping skills is important. Being present with them, giving yourself permission to really be in the moment is so important for that relationship to happen. Offer to help with specific tasks. So this is not necessarily maybe you as a therapist, but finding, or if you're working with the support system, right? What are specific tasks, or encouraging your client to advocate for that? A lot of times the grievers will be asked, well, let me know how I can help, or how can I be of support, or I'm here for you if you need anything. And sometimes they don't know what to do with that, right? And so as a non-griever if you encounter a friend or a family or someone who's grieving, that might just be offering, you know what, can I drop off some groceries for you on Monday? It is a better approach than saying, let me know how I can help. Allow me to come and help you throw in a load of laundry into the washer. Whether you are a helper in a capacity as a friend or family member, offering specific help can be really helpful to the griever. Sometimes they don't know how to ask for, sometimes they don't know what it is that they need. And if you're working with the griever, encouraging them to advocate and ask for that specific support. I'm really having a hard day. Would you mind picking up Johnny from school? And giving themselves permission to seek support from others. Suggest you're open to talk, listen, and just be with. There is no expectation that I am here for whatever it is that you need, and being open to whatever possibilities there may come up for that session. And don't minimize the loss and validate feelings or rush the process. That seems like a given, but that is a message that they are also receiving from others. And sometimes clients will also minimize their own loss experience. They might say, well, I only experienced the death of my cousin, but my sister's had 3 children die, and so her loss is greater than mine. Or comparing their loss to some ambiguous person, or this belief that somebody else has had a greater loss experience. That is something that I work with on clients, is just validating their own journey, that no one loss is greater than others. I see that also in support groups where we have individuals who've experienced different losses, and they might say something along those lines. Well, I know this other participant's loss does not compare, and we're not comparing, but we're honoring and validating our own journey, and that just because somebody else's story is different doesn't make your experience any less real for you. And so really validating their emotions and feelings about the loss, and helping them to validate and honor their feelings and not dismiss is, I think, another important piece. Talking with the caregiver. So what does that look like with the griever? So expressing concern. If there are concerns that you have, it bringing those to the table and having an open collaborative relationship of how you can support one another. Being genuine is so important. Being your authentic self, it really will be helpful in that process. You don't have to have shared life experiences or commonalities, or have experienced loss yourself to be of support. So just allowing yourself to be present is enough. Inviting that conversation, so inviting them to share if they want to share, but also not pushing. If they're not ready, that's okay. And I think my next slide is on cues when the griever may not want to talk about that loss. Listen and observe. Just making those observations and bringing it to their awareness can be helpful. Limit personal sharing, and I know that that's discussed in the program, right, in your graduate program, but I think that also a lot of times just outside of the therapy space, we might say something along the lines of, my grandma also died, so I know how you feel, or sometimes things that come up, and so we really just want to create space for them. I'm not opposed to sharing from or drawing from our own experiences if it is in service of a client, but really the priority is creating space for that. Offering practical advice, like just going down to the basics of how can we get your basic needs met. And that might be something like encouraging to join a support group, or finding an extracurricular or hobby, things along that nature. What not to say or do. Bright side statements, or if you find yourself saying at least, just stop, don't continue your sentence. At least he or she isn't suffering anymore. I know those statements are meant to comfort, but it does minimize the griever's experience. So we don't want to use phrases like at least, or anything that really brings that positivity to the grief loss experience. It invalidates their experience. Sharing about your experiences. When my father died, I was blank. Again, not about you, it is about the client. So how can we create space for their experience? Giving unsolicited advice. You should go out and have some fun, go distract yourself. That is not something that we necessarily want to do. If you're exploring coping or you want to activate or encourage positive or healthy coping, you know, there's another approach, right? But we don't want them to feel rushed in that process. Making assumptions. You've handled your grief so well. That is something that a lot of grievers sometimes come to me and share in therapy. You know, it really irks me when someone says, oh, you're handling it so well, you look so put together. A lot of times it's this mask we wear because we need that to survive, to get through the workday, to get through the school day. And so that external expression isn't always congruent with the internal experience. And so not assuming, but rather asking. And then rushing that grieving process, right? It's been 6 months, it's time to start moving on. That is not helpful, and just honoring that everyone will be on their own journey and their own time to move through that grief process. I'm going to skip this slide and move forward. So respecting cues from the griever, avoiding the topic. This would be an example where you might bring up a conversation about their loss or grief experience, and the client circumnavigating or changing the subject. They may not be ready to discuss that with you. Brief responses. They may give short or non-committal answers like I'm fine, it's okay, when asked about their feelings. Superficial responses, that might be a sign that they're not ready to go there or discuss that at that time. Body language, avoiding eye contact, crossing their arms, turning away, just indicating that they're uncomfortable with that conversation. And then there's the physical withdrawal. It's really, as a therapist, I think it's finding a balance, because our role is maybe sometimes to push a little, right? We want them to process things that may be difficult for them to draw out of themselves, but we also don't want to create an unsafe space where they feel forced to share something that they're not ready to talk about. That might not be the time or space, or they may not have the internal resources to process that just yet. And so just being aware of the nonverbals and verbal cues that you may be getting from the client. So some basic techniques to support the griever. One, I'm really driving this today to you all, is using that concrete language like dead and died, body stopped working. That is going to help facilitate just accepting the reality of the loss. Two, symbolism and metaphors, finding ways that bring connection to the grief experience and helping them to understand that with something that may be a little bit more relatable to their day-to-day life experiences. I utilize a lot of the expressive arts. It can facilitate expression of emotions. I think it is applicable to all ages. I am not opposed to utilizing play, games, art, music, even with adult clients, and I'll talk a little bit more about that in the next slide. I did feel it would be helpful to share a little bit about the top-down versus bottom-up approach. And when we're processing grief with the clients, it's also determining their capacity to be able to benefit from certain approaches. Some of you may be familiar with this, and some of you may not. So I'm actually going to stop my screen sharing here. Have any of you ever heard or practiced, or maybe you've learned the brain hand model or utilized that with clients? See a yes in the chat, only in class. I will this will be a refresher for those of you that utilize the brain hand model, but I do want to just take a step back. I've got a few interventions and that we're pretty much nearing the end, but I just like to preface the interventions with just giving you a little bit of just feedback on how I conceptualize a case or a client and their needs, and helping me determine where do I go. I think about the client that was staffed this morning in the panel. And there really is a lot that's happening, right? So if you had a client that came and shared this story to you, it may feel overwhelming. Where do I start? There's the loss of the first husband, the new loss, children that don't live in town, symptoms of depression. And it's like, whoa, there's a lot. Where do I even go? And so sometimes it's taking a step back and just evaluating the client, their level of functioning, what are their immediate needs, and then how can you build from that. And so I really like the brain hand model. I will explain it to clients as well. For those of you that are not familiar, it's just kind of using your hand as a makeshift model. So this part would be considered your brainstem. This is just controlling your autonomic functions, regulating those involuntary actions like breathing, digesting, all regulating your heart. All of that would be just kind of this part. This is the first part of our brain that is developed in utero. Here you have your limbic system. This is the part that regulates emotion. And then your thumb would be your amygdala, which is our flight, fright, freeze, right? It's the guard dog, the watchdog, so to speak. And then this would be your prefrontal cortex. This is like our higher order thinking. This is where we can rationally process information and understand that, right? So when all the parts of our brain are working together, we would call that an integrated brain. Sometimes when we experience chronic stress or trauma, we call this flipping our lid. That means that higher order thinking is not happening, right? We're working with just the limbic system. We're reacting on our emotions, regulating emotions. This would be the behavioral responses that we're seeing. So sometimes when an individual is experiencing or has experienced compound stress or trauma, using the example from this morning, they may be really just kind of working with this part of their brain. And so if we come to them with our CBT tools and we're trying to analyze, for example, what are some of the unhelpful thinking patterns you've noticed? They may not have the capacity to really process their grief experience because they're not there yet. I would equate that to if you had just kind of like a desktop computer and you turn off the monitor, you may be sending messages, but it's not always being received. Or if you think about a child at the grocery store and they're throwing a tantrum because they really want a candy bar and parents said no. Even if you try to talk to them and, hey, we can't have a candy bar, they're not listening, right? It's going one ear, coming out the other because they're very dysregulated. And so once that child is regulated, the lid comes back on, then we can have that rational conversation about why, whatever it is they were requesting wasn't possible. And so really just kind of thinking about that. So in therapy, when I'm looking at how do I approach this client? How can I meet their needs? There's two forms of therapy. So there's top down, and then there's bottom up. So top down would be your CBT as an example, traditional talk therapy. Those are top-down approaches where you're able to cognitively analyze the situation and support the client in that capacity. Bottom up is more of the somatic processing of that experience. So that might just be experiencing those emotions, those life experiences on a very basic level. It might be giving relief to their nervous system, you know, teaching them coping skills, meditation, mindfulness. It might be, I've had many adult clients who say, you know, I don't even know how I feel. I feel numb. I can't even begin to articulate or process this. And so that might be something where I say to them, you know, how about we just utilize paint and allow whatever comes out to come out. And you don't need to give it words, you don't need to label it, but they're experiencing that on a very somatic level. And so we can keep processing until they're working with a fully integrated brain, and then we can work our way up, right? And so you know, as I was thinking about the client in the case study, for those of you, I'm assuming most of you were with us in the morning, you know, I was just kind of thinking, I don't know if maybe a top-down approach would be appropriate with that client, because it feels like we're just kind of working our way up, right? We need to give this client just basic skills, coping skills, meeting those immediate needs, and then working our way up to processing this immediate loss, and then maybe even processing prior losses if that's something that she's looking to do or hasn't done yet. But if we begin to kind of stir up all of these grief experiences and storytelling about the trauma and the loss, and they don't have the capacity to process it, that can be a really overwhelming experience and may not be a safe therapeutic environment. And so I always like to keep that in mind when I'm selecting interventions, or how am I going to approach this. This individual's need is going to be really kind of thinking about where they're at. So this graphic tells you a little bit about, you know, what is our upstairs brain and downstairs brain, but also this idea of the top down, bottom up. So top down is really just processing that trauma or that experience by talking and thinking, verbalizing those experiences. I've had clients who have come to therapy and said, you know, I can't even remember what happened at the funeral. It's a blur. So how can I come and tell the client, okay, we're going to work on task 1. Let's retell our story, when she doesn't have a story to tell, because again, not fully integrated. That upstairs brain may not be on yet, so that we have the inability to process that, right? But I may be able to say something like, I know you don't remember many parts of the funeral, but what are you feeling in your body when you think about the death? You know, what might that look like? Maybe we do a body map. You know, what colors would you use to describe this feeling that you have in the pit of your stomach? So we're not necessarily using the traditional talk language, but we're working our way up to that. Does that make sense? Any questions before I move forward? I can't see you all again. I'm assuming that's a no. I can't see you all, but I'm gonna move forward.
No questions. No.
Yes. Yes.
There are no questions.
Oh, no questions. Perfect. Thank you. So we're going to move into the intervention pieces. So some of you were asking a little bit earlier, what are some examples of things that I could do with the client? So with task 1, again, this is really helping the client to identify their grief story and helping them begin to verbalize that. With task 1, one thing that I really like to do with the client is grief in 6 words or less. This is not something original that I came up with. It's actually part of the What's Your Grief project, and there is a website, griefinsixwords.com. where individuals are able to submit their grief and their grief phrase. And so essentially all that it is creating a visual and art. I like to use personally old magazines, and I might use just like a small piece of scrapbook paper or cardstock, and I will invite them to select graphics or words that represent their grief or what grief means to them in 6 words or less. So the example here was taken from the Grief in 6 Words .com is everything changed with that one knock. So for this example, I don't know the story behind it. I used it as an example. That could be right, getting the news that the person died, and that was the significant the moment signifying that their whole life changed in that moment with that one knock. I have done this many times with several clients. It's really been such a therapeutic part of their journey for them to really acknowledge what grief means to them and how that has impacted their life. And so I do have here, I was hoping we would be able to maybe have some dialogue. I know we're running a little short on time. You could do something where you utilize just a preset group of words and help them pick out a few. If you need greater containment for the client, or you could open that up to really them coming up with their own phrase. I find that most of the time the clients like to look through the magazines or look through a list like this so that they can begin to get ideas, and then they can work from that. So that's an activity that I think can be easily facilitated and would tend to task 1.
Hey, Ms. Waddle, if you did have an activity planned or you wanted to have a little more dialogue, that's totally fine.
Oh, no, I think we're okay unless anyone wants to. I don't want to pick on anyone either. I
Okay.
was going to just invite, if anyone wanted to share or come up with one, but I think in the interest of time and everyone's been so gracious with questions and sharing, I think we're okay unless anyone really wants to do this.
Okay, I just didn't want you to feel like, you had to rush or anything.
Thank you. I appreciate knowing there's a little bit of leeway there. Yeah, so this is task 1, very basic. I've used it. It's been really effective. I've used it, I would say, with adults and maybe some of the older adolescents, not young children, if that may be a little bit too big of a task for them, depending on their developmental level. Questions on task 1 before I move forward? For task 2, this is, here we are. Task 2 is working through the pain of grief. So again, task 2 is feeling the feelings. This is really just creating space so that we can bring awareness to our emotions, express those uncomfortable feelings, maybe some of those quote unquote taboo feelings, and finding some type of expression for that. So there are a couple of different ways that you can utilize this. One thing that I do, and also just keep in mind, I am a play therapist, so I tend to integrate some of those experiences and just interventions with even my adult clients. And I will tell you that I do a feelings check-in. I know some of you probably do this with your little ones. I even do it with adults. I've done it with grandparents. No judgment. I always like to validate the process by just introducing them to that. So very early on in the relationship, I will tell them, it's part of my practice that every time that you come in, we'll just do a quick feelings check-in. I'm going to have a little emotion chart for you. This is really just a part of the process to get you into the practice of checking in with yourself. What is it that you're feeling and why are you feeling that way? Many times adults may find that they're very busy with their responsibilities and don't always make time to check in with themselves, especially if it's a parent a lot of times the greater energy or focus is on helping their child or supporting someone else and may need to, or that their support. And so they're very responsive. I've never really had resistance, but I have seen so much insight happen with something as simple as a little feelings chart. I remember one client specifically who came in and she just stared at the feelings chart for the longest time, and she's like, "Oh my gosh, I don't really know. I've just been on autonomic for so long." And then started, I gave her a marker and she started circling, and she's like, circled half the page and said, "Oh my gosh, I didn't know I was feeling all these things." And she just kind of went through each one by one. "Do I feel that? Yes. Okay." And circling. And so then we had an open conversation about that, and we talked about the different manifestations and also what that does for her, right? Like, you've been carrying these 15 emotions on top of caring for your child, on top of these new roles and responsibilities, that it really validated, like, no wonder I'm so tired, no wonder I'm so fatigued. And it seems obvious sometimes to us as the helper, but sometimes the client doesn't give themselves space to really check in. So I find that to be helpful. I'm not biased by age. We're all going to do this. And so that's just my approach when working with adult clients as well. I think that we can all benefit from just checking in with ourselves every now and then. But another thing that I like, and I'm working I'm at another office right now, so I don't have my box, and I regret not having it with you, but I have been collecting hearts for a couple of years. All my friends and family know that I collect hearts, and so I have a basket in my other office with the collection of hearts, and every time I go out of town, I always like to make a visit to an antique store, and I just look for a heart. I have all kinds of heart-shaped things. If you want to make a collection, this is the best time because it's Valentine's and there's all kinds of hearts right now. And what I do is I have just my little basket of hearts, and I will bring it to the table and invite the client to select a heart that best represents where they're at in their grief journey now. I have broken hearts, I have black hearts, I have I think this is one that gets used a lot, is I think I got it at Hobby Lobby, and it's just a clear plastic heart that is like 2-piece. I think you can fill it in with chocolates or whatnot. And that one gets used a lot because a lot of times grievers will talk about feeling empty, feeling like their heart is hollow. And so there's a lot of just symbolism and metaphor that comes into this. And then inviting them to select one, and then we just have open conversation, and we can fill the whole session just by inviting them to describe what their personal experience is like. It also just really helps, and it can go in a lot of different ways. Sometimes clients will utilize the heart that they selected to represent where they're at in their grief. Other times they'll select hearts that talk about their person. I do have one little one here, and I did have a client who had shared, who had selected a heart that was very girly and glittery, and had shared that heart reminded them of their person that died, and then just went on to describing their loved one and the essence of who they are, and then we segued into how do we continue to have that connection. So it can go in a lot of many different ways. You do need to be invested in making that collection, but you could do that. You can create it in a lot of different ways. There's a book that I really like called A Heart's Journey. It is a beautiful book. It's just illustrations. It's a small little book, and it's a journey of a heart that starts as just a whole intact heart, and as it's progressing through the book, a dark shadow starts to envelop the heart, and then it starts to break and crack. And then at the end of the picture book, there's little seeds that begin to fall into the cracks, and then flowers start to grow. And so it's kind of this journey of this simple heart. It started with a simple heart, went through some hardships, was broken, and then came out on the other side even more beautiful than it was at the beginning. And I've utilized that book as an alternative to this, where I will show them the book. It's about 10 pages. It's only illustrations, doesn't have any words. It's open to interpretation. But then I will invite the client to select an illustration in the book that best represents where they're at in their journey. And then I'll invite them to paint that on a canvas. So there's many different ways you can do that. I do have here on my next slide, oops. I just took some graphics from the internet as an example of the types of hearts that you may be able to incorporate into your session. Really just having a variety and then inviting that conversation of which one best fits their experience at the moment. So you can see there's the broken glass heart. The little white one in the middle is just like a paper plate that was colored by a child, the little black heart. So just kind of having a variety. I think you could even go on the internet and print a couple and then bring them. You don't have to physically collect hearts, but I thought that that has been just a really good conversation piece, and just helping to articulate their grief experience without necessarily starting with words, right? Having tools that can help them best represent that experience. The next one is task 3. So task 3 is adjusting to an environment in which the deceased is missing, and exploring this new life, right? And so what I tend to do when a client is working through task 3 is really creating space to acknowledge all of the changes, everything that has happened. I think this activity in itself is probably a combination of task 1 and task 3 activities. Task 1 and task 3 in Worden's model. But this idea of 1, telling our story, which is where task 1 comes in, but 2 is also just creating space to acknowledge all of the changes that have happened. And so one of the things that I've done with clients, you can buy these on Amazon. Just look up cardboard looms. The one here on the right-hand side, the squared one, is on a cardboard loom that was purchased online. And then the one on the left-hand side, the circular one, I've done with just cardboard, just a cardboard cutout, trace a circle, a cup or something, and then you put little slits. The same concept with the longer cardboard loom, and it's a weave. And so very basic. You can find YouTube tutorials if you want to learn how to utilize the cardboard loom. And essentially they're just going over and under, as you see on the graphic here with the purple yarn. They're just weaving in and out. There is something very therapeutic and soothing about the weaving process. And I have done this with clients from the very first session, and we finish it at the end of their last session, just depending how much time you want to invest. But it is utilizing different colors and textures of yarn. I've had clients who have brought in like an old cut up t-shirt, and we've done it in strips, as you might see here with the purple piece here on this weave. And we select colors and textures that represent different parts of that story. So it might be the first colors that we're going to utilize represent the part of your life where they were still alive. What was that like? What did that look like for you? What were those experiences like? Maybe the next one is when you found out they died. Maybe the week following is the weeks after the death, when your grief felt the heaviest, and then progressing to telling their story. So I think this is That aspect of the process is very much task 1 oriented. Where the task 3 comes in is where we begin to acknowledge all of the changes, how their story has changed, and really acknowledging that life is always evolving, right? Life is always changing, and how do we incorporate those life experiences so that we can move forward and reinvest. I've also utilized beads. And we'll add strands of bead that represent coping or significant moments that they can weave into their loom. So that way it also represents the positive aspects of the grief experience and the things that they've learned along the way. This I've done with all ages, from probably upper elementary through adults. This is something that has been really well received and they've enjoyed. The smaller circles you can probably finish in 1 to 2 sessions. The bigger looms do take time. And sometimes I find that even keeping busy or keeping our hands busy does sometimes allow or makes conversing about their loss experience a little bit easier. And then the last task is task 4, which is to find that enduring connection with the deceased, right, while embarking in a new life. This is being able to honor the life of the person that died, and then also being able to move forward. This is a children's book that you see on here, The Memory Box. I love this book. It is one of my favorites. If I understand I'm given permission to go slightly over, I am going to share a little bit with you. There's a read out loud on YouTube just to highlight some of the key components. Again, I'm not opposed to bringing in books, children's books. I've used it plenty with adults and they're well received, so don't be shy about that. Like I said, it's one of my favorites, so I think that a lot of adults as well, and if you're working with children, certainly appropriate that they have found this to be beneficial, and I think really gives them permission to reinvest in their life. So if you will enlighten me, I will share this with you.
A Book About Grief by Joanna Rowland. Illustrations by Thea Baker. I watched it fly, higher than the trees, above the clouds, past where I couldn't see. I was so sad. But not as sad as I am now. I can always get another balloon, but I can never have another you, and I miss you. Sometimes I wonder what happens to your love now that you're gone. Did it die too? Because I'm scared I'll forget you. Sometimes I wish I could still give you a hug. I would hug you so tight in a great big bear hug and never let go. So I'm making a box so I won't forget you, with our memories like sand from the beach where we played and left footprints as we ran from crashing waves. I want to go everywhere you've been. I want to go everywhere we've been. Everywhere we wanted to go. I want to go to places that help me think of you. I look around and I remember it makes me smile. Then I find the perfect thing for my memory box. Some days are good. I laugh, I smile. Other days I wonder if I'll ever stop feeling sad that you're gone. But I always think of you. So many things remind me of you. Today, I'm asking everyone about their favorite memories of you. Sweet, silly, some Just so you. I'm listening to every word, imagining you laughing with us. And it helps me when I think about our special times, and it even helps to still do the things we've planned to do together. You're still with me in my heart. Now I'm making new memories. My first time on a roller coaster, trying a new sport, exploring a new place. I'll always share these memories with you. I was afraid I would forget you, but I won't. You'll always be with me, no matter where I go. Whenever I miss you, I'll think of you, and I'll never forget.
I am going to stop that there. I think it is such a beautifully written book, and it touches many aspects. One is validating those emotions that some days feel really difficult and other days feel a bit more manageable. Also having that piece about doing things that they talked about doing, right? Giving themselves permission to do all the plans, like I go back to the family who wanted to go to Disney, that it's okay to do the things that they discussed, and that it's okay to try new things and do new things. I know that the target audience is children for this book, but I think it is written in such a way that it's applicable to all ages. And then having that conversation, right? What does this mean to you? And then the piece where she's collecting stories from others, where she's learning about her person by all of the other people in her life. And I've seen that even with adults. I've had adult clients where maybe their child died and they hear stories from their child's friends or partners or girlfriend, and they learn different versions of who that person was. And so that relationship can continue to grow and develop in time, even after death. And one of the activities that I really like to do with families is of all ages, and I've done this with adults as well. It's just a little small paper mache box, or if they want to bring their own box or a jar. It really doesn't matter what you use as the container, but I will use different strips of paper. So for example, I might have like 4 colors. So your daughter's favorite color was pink. So everything, all the pink strips of paper will represent the memories you have of her. What are all the beautiful memories you have, the funny, the silly memories that you want to hold on to. Then I might say, okay, all the purple ones will represent affirmations. What are some affirmations that you can continue to tell yourself on a difficult day? The green ones might be the intangible gifts. Those are things that I talk a lot about because it's not necessarily holding on to the material objects of the person, but it's the intangible gifts. What are the lessons taught, the values, the beliefs, the things that we're always going to carry in our heart, and then listing those on another color. And then they just put them in that box or a jar or a Ziploc bag. It doesn't matter what your container is. Of course, you can expand on that by decorating a box with collage or what have you. But the idea is that they have something tangible, because many grievers talk about feeling like they're forgetting. I'm forgetting what they look like. I'm forgetting the memories we had, or even if they're not forgetting, the fear of forgetting, right? And so just creating a space that they can do that and that they can continue to add to it. If they want to give themselves intentional time to grieve, that they can go to that and revisit that. If they're looking for encouragement or support or positivity, that it can really be whatever it is that they want it to be. But the intention behind that is that we're continuing those connections with the person that died. And then the last slide I have for you all is, when does one need help? Not every grief experience will be indicative that someone needs professional support. Some individuals and children and adults alike may have the internal resources or the external resources to navigate that without professional support. However, if they describe having strong feelings or emotions that interfere with their daily living, if they're so sad that it makes it difficult for them to go to work, if they're so angry that it's affecting their relationship with other family members or friends, those might be indication that the person is struggling and may need additional support. Disruption with just their basic needs, eating, sleeping, is that prolonged? Is that impacting overall their daily functioning? Increased isolation, describing or verbalizing feeling alone in their grief experience. Repeatedly wishing that they joined the deceased, making comments like, I can't wait to be with them again, if only I was in heaven. I don't have a purpose on this earth anymore, no one needs me anymore. Those would definitely merit further exploration for suicide ideation or risks to suicide, and frankly would be someone that maybe would need a little bit more support to work through that. Witnessing a violent event, a traumatic event, or even being present at the time of death could be things that maybe would indicate the individual needing or wanting to work through some of those experiences. Having little or no support system, if they don't have the external, or I will add internal resources to be able to cope with the loss on their own. And then significant or drastic changes in behavior that is a risky behavior, right? Substance use, increased consumption of alcohol, engaging in risky behavior. Sometimes some adults that I've worked with have described, well, I just, tend to drive more recklessly. I really just have a disregard for my life, not necessarily a desire to die, but also not a desire to protect one's life. And so those are some of the things that we would want to look out for. Of course, just kind of the overall is it interfering with their daily functioning? And if it is, then maybe exploring, but also not jumping to the conclusion that someone may need help. Intense emotions immediately after a death are natural and to be expected. However, if that's prolonged over longer periods of time, then that's when maybe having that dialogue would be important. And I think that is it for me. I appreciate everyone's time and patience and interactions. I'm not sure if anyone has any questions. I know that you all have a little bit more of a discussion to continue. I did have one more slide I just realized, and it was just a self-care. I can email the PowerPoint so that you all can have access to that. My last slide was really the self-care piece. Grief work can be heavy, and so it's important to take care of yourself. A dysregulated person cannot help a dysregulated person, and so making sure that you are in a good place to be able to support a grievers goes without saying. But yeah, I don't know if there's any final questions. Right, well, I hope this was helpful. I hope that you have some takeaways that you may be able to implement, whether that's with the client you're seeing now or down the road. I will send my contact information in case you have any questions. Please feel free to reach out. I would like to be a resource to you. And then I'm guessing I could send the PowerPoint to one of the facilitators and that will get disseminated. Yes. Perfect.
Yes, if you could please send it to one of us and then we'll send it out to everyone here.
We'll do that. Thank you.
Thank you so much. This was a lot of helpful information. We appreciate you for taking the time to be here today, to do both our panel and the training. Both were amazing. Thank you so much.
Thank you. My pleasure. You'll have a good rest of your day.
Thank you.
So thank you.
Thank
All
you.
right,
Bye.
everyone.
All right.
So,
Go ahead, Lena. I'm gonna shut up.
do y'all want to take a break or are we good to go? How are we feeling?
I'm down for a light 5.
Okay. Okay.
All right, so let's do a 5-minute break. Let's come back. Let's make it 7. Let's come back at 1:25, and then we have a short video to talk about, and then you guys can be gone for the rest of the day. Okay? All right, so come back at 1:25, and then we'll go over the video. All right, as we bring it on back, bring it on back, bring it on, bring it on, bring it on back. Gotta have my mic on, okay. So we talked about grief all day today. And so I did my darnest best to find a decent video of role play. Okay. So this is the most decent one I can find. I'm giving you guys a heads up right now. It's real cringeworthy. Okay. And so we are going to watch it. I want to say it's an 8-minute video. And then we can have a brief discussion about it, and then you guys can go, okay? Let me see how I'm trying to share my screen, but it's desktop, nope. Google Chrome, is it this one? Oh, no, it's this one. Okay, here we go. Trying to move you guys away. 8 minutes and 15 seconds.
Good afternoon, Louise.
Hello. You guys hear it?
Louise, I'm Kim.
Okay, Kim, how are you? It's a pretty name.
Oh, thank you. Come
Kim.
take a seat. How are you feeling?
Oh, I'm not too bad. A little bit funny, but I'll be okay.
Right, okay. So a little bit funny, can you?
I just feel a little bit funny talking to people about things, you know.
You haven't been to counselling?
No.
That's all new to you. That's understandable.
Very new.
Completely understandable. I'll explain a little bit about me, my role here in the service, and a little bit about the service, and we'll talk about your reason you're here today.
Thank you.
Okay. So I'm one of the counsellors here, and we've got 5 counsellors as part of our practice, but we all do different.
Oh, we lost the audio.
Myself, I'm one of the counsellors for loss and grief. Okay, so anyone who's experiencing some loss and some grief will come through, and we'll have around 6 to 8 sessions and go on a little bit of a journey together. So that would be good. Part of that, Louise, is with our confidentiality I'd like to talk to you about. So you'll get some booklets when you leave today about our organisation for you, and that will help you to be able to understand our confidentiality. But I am a manager and reporter, so what it just means, Louise, is I'll be writing some things down today, okay, but that will all be kept confidential. But if I'm concerned that you're at risk, or anyone, like a child is at risk, or you're at risk of harming yourself, okay? And even if you talk about possibly that you're thinking of, or something's been involved in some type of illegal activity, I'll need to report them to the appropriate people, so you can have that support. It was always just so you can have that support through what's happening with yourself and your emotions. So
that's understand. Yes, no, that's fine.
Right. So what has brought you here today?
Well, it's a little bit hard for me to say, but my husband of quite a few years.
Right. How long?
Or roughly about 40, 35.
Oh, wow.
Roughly.
Right.
I sort of try and think when it was, and because the children have grown up and have their own lives, so it's roughly around about that time.
Right.
And I think he asked me to leave the house because he found somebody else.
When did this happen?
Oh, probably around 6 months ago that he first told me.
Right.
I mean, it took time for me to get my things together and move. I couldn't take all my stuff because I'm only in a shared accommodation now.
Right.
So some of my stuff, I have that some, but I've stored it in the garage there. So he's still in the house. So, but yes, the person that he is with now, is a lot younger than me. That makes, yeah, it makes it a little bit hard. But yes, no, it's I don't know. I don't understand it all.
It's quite a challenging time for you. So you've experienced 6 months, and you I know you've been referred by your doctor, and so he's possibly with the loss of all that you're going through, definitely loss and grief there.
Well, it was my life.
Yeah, right. So that loss of that life and that
all the memories of the children growing up and things, I feel it's just gone.
Did you go through shock, can I ask?
Yes, I did. It was a shock.
Right.
It was very sudden that I was told. I had no idea that it was, I mean, you know, I suppose husbands stay out late at night and people just think they're working, but no, when he did tell me, it was really hard.
Okay. They've been happening for a while, those
I think so.
Okay.
I haven't been told how long, but I do think it has been.
Did you have anyone to talk to at the time that happened?
First, my daughter. My son and his wife live a little bit further away, so I talked to him on the phone, and he's very good. But yeah, no, that's about all I have. So yeah.
No, all the different feelings at the time.
Very hard.
Yeah,
very hard. I just don't know where it's gone.
Right.
My whole life, it's just gone.
And you've had some people to talk to you about how you felt.
Oh yes, yes.
So at the time, you know, the shock and the feelings. What other things can you explain a little bit about what's been happening for you?
It's just really sad because I still do care for him.
Of course.
I did suggest that that we try to work out our marriage, and but he didn't want to do that. I tried everything, but yes, no, he just wanted me out.
It's experiencing a massive amount of loss and grief there, Louise, you know, because it's leaving your home.
Yes.
Your marriage that you didn't want to.
Yes.
Massive. And the shock of everything that you would have experienced. All those different years, different things, memories and all that.
Oh yes, and I feel now that I just sometimes I sit there and I think I just want to wipe it all out. And then I think, no, I can't do that because I've got children.
Yes, right.
So those memories can't go.
Right, yeah. So you're talking about memories. So.
Oh yeah, memories are really hard.
Definitely. And what about yourself? How do you feel about yourself at the moment? Have you got what type of
why wasn't I good enough?
Okay.
I thought we had a good relationship.
So it's the loss of it, and it's the feeling that why?
Yeah, I don't understand.
That's a very difficult challenge for going through, and you've suffered loss prior to this, and loss is such a different. When you've got somebody that's still there, and it's a hard task to go through a grieving process for someone that's still alive, and you thought that you'd have this life with them and so all the feelings and emotions and things that you're going through is quite normal. If you thought of a process before that when you're grieving, all the different thoughts and emotions that you're going through?
Well, I do understand it, but when you're going through it, that just goes out the window.
And it's also different with every single thing you're going through. So that's completely understandable when you're looking through all the different things you're experiencing. But you do understand that they're all just normal emotions.
Yes, I think so.
Yeah.
I just
think it's challenging.
I try to think of it, and then I end up with that one word. But why? But why? You know, we were happy. Why?
At the moment, with the questioning and with the things, have you got anybody that you can talk to about that type of thing? Have you got that support?
I've got one friend that I can talk to. And she's very understanding. But she says, and
What's the difference between a service animal and an emotional support pet? Well, a service animal has to go through long.
Stop sharing screen. All right, so actually there was another one that was cringeworthy. That one wasn't that bad. So from what we learned today, what could be some things that we
Hi,
could
this is
use?
Dr. Grande. I hope you find this video useful. If that's the case, please like it
Give
and
me a
subscribe
second.
to my channel.
Ooh, laughing.
We can't hear you.
Yeah, I had to mute myself because my YouTube was still playing. And I had to go stop it. But let's at least name, what time is it? Let's at least try to name 5 things that Miss Waddle gave us from our training that we can use with this particular client. So this isn't of a loss of someone who has passed away, or as she would say, died. Using that language. This is something totally different. This is a loss of a relationship. So she comes home and her husband's no longer wanting to be married to her. What could be some techniques, tools, or what would even be a theory that, what part of a theory could we use? Let's kind of name 5 things. Once we get to 5, I promise I'll let you guys go. I promise.
I mean, we could ask her like what she's doing to like try and fill this kind of void from like the loss of the relationship. Kind of like that one question, what are they doing to kind of like manage the loss?
Okay, that's one. One more to go. Helping them manage the grief. Yes, Jess said using the bottom up method. That was going down.
I would
To
say
explore.
she mentioned the warden's 4 tasks of mourning, like accepting the reality of the loss. It was kind of hard to hear, so I couldn't really tell if she kind of had the understanding of accepting it. But I would probably start there, like making sure they understand what's going on.
Yeah, she was struggling in why the relationship wasn't working because she mentioned she wanted to work. I was trying to make the captions work, but then it was speaking in Spanish, and then when it was speaking in when it started speaking in English, it wasn't even using the correct words. Suzette said looking at all the grief stages to see where she is acceptance. Okay, all right. That's what, 1, 2, 3, 4, one more. Because Jess said using the bottom up method to explore how her life is, how it transitioned, initial body scanning to manage feelings within the body before processing the event. Yep, that's good. Thanks, Jess. One more. Nobody wants to get out of here.
Who wants to take us home? Who's gonna give us a mic drop moment?
I mean, I would also say like evaluating how she's adjusting to the situation and maybe providing feedback on how she could better adjust to the environment, like also evaluating like her social support systems, who she turns to and who she's in contact with, any social support groups that she's in. I know, I forgot her name, the trainer. She mentioned how a lot of patients or clients have like support systems in the church or maybe outside family wise. So I guess kind of evaluating those things to see what would work best for her.
Okay. Yes, Megan, let's everybody give Megan a round of applause because she is the one that saved us to go home. Thanks, Megan. Alrighty. Well, I know you guys are ready to go. So thanks for participating. Thanks for having cameras on.